Oh,
Maybe I just don't want to disturb myself.
there
I
you
can.
go.
I have to step away for just a second, but I can hear you.
Okay,
I just gotta put my dogs in a room. So you go ahead.
Oh, so you're gonna fail right off the bat.
that's right. He's out.
All right. So welcome everybody to the coaching course. We have a lot that we're gonna try to put into day one. We'll try our best not to overwhelm you, but mostly we want to give you some information, some background on health and wellness coaching, on how it's going so far and where it's going and that kind of stuff. Kind of give you an idea of where you can take coaching. Before we get into the content, we're going to do a little bit of an introduction for everybody. So I guess we can start with faculty first, and then we'll jump in and let you all introduce yourselves. Some are familiar faces, some are not. So I want to make sure everybody's on the same playing field. So I'll start with our steady, good old man that will be here forever. We want him to retire with us and stay with Wellness Effect forever. So Todd, I'm gonna turn it over to you first.
It's kind of mean to call me old,
I thought you'd catch that.
but no, yeah, Todd Rayleigh, I'm social worker by training. Well, actually, I'm a soldier by training. I did 24 years in the Army before I retired, and then I
Dad was very manly.
got out of the service. Got my master's in social work. I was the first person hired as a health and wellness coach down in the VA in Tennessee. Been board certified coach since 2019. That's like the third or fourth cohort to go through the coaching exam. And currently I'm in Tomo, Wisconsin, where I'm a whole health program manager. Got 8 coaches, group wellness instructors, employee wellness coordinator, and a bunch of admin staff. And we run a whole health program for roughly 21,790.4 veterans. I don't know how they get to that. That's my catchment. The 0.4 just amazes me. But and I love teaching, and I hope that comes out through this course, that you guys can tell that I love what I do.
100%, because he does it so cheap for us. Almost free. No, I'm just kidding. All right. I think Todd, he is the man. So if you ever have questions, he's a good one to ask. I will let Charlie introduce himself.
All right, I'm Charlie. I'm a social worker by training as well. I have a master's from East Tennessee State. I am a United States Marine as well. I served 4 years in active duty, did 2 tours in Iraq, then also served 8 years in the Army as a behavioral health officer. So did that for a while. Worked at the VA. I was working at the VA for probably about 5 years and then left that and then now started this business, and hopefully we'll be able to continue to grow this. We've been working on this health and wellness coaching course now for probably 7 years total. We've graduated countless people. We've been working on this curriculum. We have people like Todd and some other faculty that y'all see come in and out of this that have really been some of the key people in developing and working in the whole health field, but in particular the coaching field as well. So we look forward to bringing this to you, and I'm grateful to be here and be here with you all. So thanks for being here.
Thanks, Charlie. Okay, so I'm Haley. I am not a vet, but happy to help in any way I can with them. I worked at the VA for about 6.5 years, worked with Charlie. That's how we met. One day he said, "You can go do this on our own." So here we are. We're doing it, making it happen. So I'm going to turn it over to you all, and I'll just call you out on the screen as you're listed, if that's okay, and let you introduce yourselves and maybe let us know what it is you're looking forward to in this course so that we can make sure we hit on anything that you have of interest and making sure we cover that for you. at some point during this course if there's something specific. Sound good? I guess I didn't tell you all that much about myself. I'm Haley and I'm here. How's that? All right. Let's start with Mark.
Hey, I'm Mark Smontarelli. I'm located in Pueblo, Colorado, and I'm a training specialist for Rocky Mountain Human Services. Used to be like a clinical care manager, and I was also a peer support specialist, but now I am in the training gig, and it's been great. And yeah, I'm just really looking forward to see what this class offers and how I can apply it and help other people and support them. So that's me.
Awesome. So Colorado, man, a bunch of people are gonna be from Colorado. I'm from Tennessee, by the way, Nashville area. If you ever need somebody to take you around town, I'm here. All right. Austin, you're up next on my screen.
All right, my name's Austin. I'm a veteran as well. I've served in the Marine Corps from 2008 to 2011. I actually met Charlie in a drone cohort. We did a drone certification, and we were roommates together in Dallas for a week. So, and I didn't have my
I'm
sleep
sorry.
apnea. Yeah, I didn't have my sleep apnea machine, so he got to listen to me more than I ever listened to him.
I was gonna say it was a terrible week.
Yeah,
Just
yeah.
playing.
So I'm currently the general manager of a roofing company. So I come from I guess for the last like 8 years I've been in the sales world, so cars and roofs, and I've trained people, and I think I'm just ready to maybe step away from the sales side of stuff. And what I've always been good at is listening and talking to people and having people open up to me. So I thought after talking to Charlie that this would be a good fit for me as far as helping people or veterans or anyone to better their life and attain their goals. So I'm just excited to see what it has to bring.
Awesome. Austin, I've heard a little bit about you and the drones, so
Oh,
that's
nice.
cool. Charlie was telling me about the drones. All right. AKA Killa, you're up.
What? It's me. Good morning, everybody. My name is Snezhana. If it'll probably take a little bit of practice, but I am a registered nurse by trade, and I was with the VA for, oh my gosh, 13 years in all different aspects, from bedside nursing, ER trauma, all the way to management. And I met Charlie and Haley on a shady street corner one day, and we just got to talking. So that's how I know them. But no, in all seriousness, I've known Charlie and Haley now for what, about a year, you guys? I think it's been about a year. And what I'm really interested in this course, and I think I mentioned it to Haley, was learning how to have more of the difficult conversations. I think everybody's had that special person in their life that just made them absolutely crazy, and whatever you tried to do is just, you couldn't get through to them. So I would like to have a little more insight and a little more practice on how to have meaningful conversations and with that person that you just have such a hard time with. And so thank you.
Talking about us having hard times.
What?
with us.
Yeah, it's okay.
All right. That shady side corner that we all met on, that's where I work. I still work on that shady corner. All right. Armando, you're up.
All right. Hey, my name is Armando. I'm also a veteran. I was in the Coast Guard from 2011 to 2017. During that time, I picked up my bachelor's and my master's. Well, not during that time. After that, I took up and got my bachelor's and master's in human performance and wellness, which is what I kind of do. I do a lot of personal training. I have my own company in personal training as well. And I just kind of want to sharpen the blade, just sharpen up my skills and see how I can further this. And originally, I was just I was planning on joining VA, so they told me that I should get this. So originally, that's the reason why I chose this. But I mean, when I look at it further, I know it's going to make me a better person in my field, and it's going to help further my career the way I want it to. So that's why I'm here.
Very cool. Thank you. And Kirby.
Hi everyone. I'm Kirby. I'm from Memphis, born and raised. I studied, got my bachelor's in social work. Currently working as a nanny. I've been working with kids for like 10 years now, and plan to continue working with kids, probably indefinitely. I think a part of what I want from this is kids kind of are easy, but adults are not as easy to me. Somehow having like those hard conversations with a child, like it clicks with them in a way that I'm like, I don't know how to have it with an adult. And that's a big part of working with kids, is working with the adults too. So that, and just, you know, continue doing something and learning, and kind of getting myself back into the like learning mode, because I do plan on going back to school soon. So
Very cool. Memphis, Tennessee. I'm not far from there.
yeah.
All right. Well, again, welcome everybody. We're excited to have you here. We're excited to help you down the coaching journey and help you down each avenue that you're looking to specialize in or jump into. And as we move forward, you'll notice the three of us, and like Charlie said, there's going to be some other faculty members that jump in. We're going to be mentors for you. So as you develop and grow as a coach, and as you want to start diving down some coaching niches or certain aspects of coaching, please ask us any questions you have as they come up, because it all kind of comes with experience. And the more you know ahead of time, the better of a coach you'll be in the long run. So without further ado, I'm going to turn this over, I think, to Charlie.
Yeah, go ahead. And I'll add to that with the faculty. I'll go ahead and try to introduce them. We'll of course make them introduce themselves, but you'll see maybe Chad Hunley come through. He's an Air Force veteran, is a radiologist by training, is a board certified coach. Moved into it, I want to say now at this point, probably 5 to 6 years ago. 5 years ago, and now he is the lead health coach for Vision 9's Clinical Resource Hub. So I know that probably means nothing to y'all, but it really is just that he oversees virtual telehealth coaching for a very large catchment area. And you know, he doesn't have many coaches to make it happen, so they kind of specialize in different areas at certain times and kind of deploy to help out certain facilities and stuff like that. So they started out in women's health, and I don't know what they're doing now, but hopefully he'll be here and he can kind of talk a little bit about that. We also have Brian McSpadden. Sometimes I call him the Colonel. I think he actually is eligible to pick up Colonel, but he's got to find a slot now, which that's the harder part once you're eligible. So that's pretty cool. He's in the reserves now. He's in the Tennessee National Guard. He spent, I want to say 8 to 10 years on active duty. He's a rec therapist by training, has a master's in life coaching from Liberty University. He lives in Texas, and he is a rec therapy supervisor, but is also affiliated with Whole Health in Waco, Texas, I think is where he's at. And I don't know the affiliation. I think right now the rec therapist may be reporting to Whole Health, or there might be some dotted line, something. Yeah. So anyway, it goes, he's working in Whole Health there. Let's see, somebody else you might see is Dr. Stephen Graham. He's a physical therapist by training. He is the Vision 9 Whole Health champion, and also the Whole Health section chief for physical therapy. He was a Army veteran. He was in the 160th, if y'all are familiar with that. He won't talk about it too much, but he was actually part of the teams that was looking for Osama bin Laden. The 160th is a special operations unit that flies helicopters. So they're the ones who fly in SEAL Team 6 in the middle of the night and do special training that way. So, you know, again, he won't brag about it, but I'll brag about it for him. I think that's pretty cool. So those are some of the faculty. I'm trying to think, am I missing anybody as far as faculty goes? You might see some other guest folks pop in, but I just kind of want y'all to be, if y'all show up one day and you just see Brian or Chad or somebody, you know, I want y'all to kind of have an idea that y'all might see some of those folks and know who they are. So, all right, so let's jump on in. So right now we're going to talk a little bit about whole health and what whole health is. Kind of a little bit about a case study that involved us. We're currently in the process of maybe looking for a new case study, and maybe that case study will be something completely different, and maybe something in the private sector. But right now, this is what we got. So really, we want to talk about what whole health is. And let me make sure my video is sharing here. Or my sound, sorry. Let's see if this will play. Nope. Let's go back. I want to scream right now. I can see it on everybody's faces. All right, let me see if I can pull this up. If I can't, it's saying that it's a picture now. Hold on one second and I'll pull this up. But let me go ahead and ask everybody, what is your definition of whole health? Whenever you think of whole health, what comes to mind whenever you think of whole health?
I would say mental, physical, spiritually. I forgot the other ones, but yeah, I started off strong and then I died down. But you get it.
Yeah. Kind of that biopsycho-spiritual model, right? A lot of people stop at the bio, like the biological, the psychological, and the physical.
Physical, yep.
But then they forget that spiritual model and how much that really plays into us. Yeah, absolutely. Let's see, anybody else?
I'm kind of the same side of it as far as like whole health. It's not just about like if you work out or eat well or have good blood pressure, you have to be mentally healthy, you have to be spiritually healthy, financially healthy, all the things.
Yeah, so financially healthy. So there goes another one, right? Something else that's kind of well-rounded that sometimes people forget that adds probably more stress, right? Because whenever you think about it, the number 2 thing for divorce is going to be financial reasons, right? So, think about that, right? Financial success. And I shouldn't say success because that's probably a bad word because success can be defined in so many different ways, but just maybe stable would probably be a better word, right? Just financially stable. So that's important as well. Nothing happens in a vacuum, right? Everything is connected. We are all connected in everything we do, right? And I think that is the broader picture of what we are looking for. Because ultimately, what in the hell?
I think I have it up. I don't know if it's the same video, though. It looks different.
Well, I was just now trying to just find one from the VA since we have a lot of VA and historic VA folks in here. So I got one now. So let's go with this. Hold on one second.
I just Googled something and it said that the number 1 leading cause of divorce is when women meet Charlie with that mustache.
That would be called the creeper effect.
I already like you, Austin. I already like you.
So Austin is already kicked out of the course. I knew we had a bet going on how fast it would take, and I said about 30 minutes. So there it is.
Mine was 15, so I just won $14. What's up?
That's right. All right, here goes the video. Can y'all see it? Yeah, okay.
Whole health recognizes you as a whole person and helps support your unique answer to the question, what do I want my health for? What is your mission in life? Whole health goes beyond illnesses, injuries, or disabilities. It focuses on your values and aspirations, your health and well-being. It may include self-care strategies and complementary therapies such as acupuncture, massage, and yoga, along with your conventional medical care. As a veteran, you committed your life and health to mission success in defense of our country. Now we want to help you be mission ready for your life. The core mission of the Veterans Health Administration is to honor America's veterans by providing exceptional health care that improves their health and well-being. Exceptional care is different than it used to be. It now includes getting to know you better, learning what matters most to you, focusing on your goals for your life and health, and supporting you in addressing your well-being and self-care. By engaging in this shift to whole health, you are not only contributing to your own health and well-being, but to the transformation of healthcare for your fellow veterans and the nation. Healthcare usually focuses on preventive care, lowering risk, and illness and disease. Are your cancer screenings and flu shots up to date? Do you feel sick or are you injured? Do you smoke or is your weight healthy? What medications are you on and how are your test results? These things are still important, and whole health is more than that. Whole health goes beyond traditional health care and focuses on what is important to you in your life and how you want to live your life. It includes self-care and things you can do to increase healing and improve your health and well-being. Research shows that the most important ingredient in being healthy is how you take care of yourself, and you don't need a medical background to do that. Medical care is important, and how you live your life between medical appointments makes a big difference. Self-care is not something you have to figure out on your own. In the whole health approach, you have the opportunity to look at all areas of your life, areas of strength, and aspects where support could be helpful to you. We call these the components of proactive health and well-being. These areas of self-care include working your body, exercise and movement for energy, flexibility, and strength. Surroundings, how things around you affect your body and emotions. Personal development, learning and growing throughout your lifetime. Food and drink, nourishing your body. Recharge, sleep, rest, relaxation. Family, friends, and co-workers, your relationships with others. Spirit and soul, a sense of connection, purpose, and meaning. And power of the mind, tapping into your ability to heal and cope. You may be wondering, how will whole health help me? Think about your own experiences. Military missions are each unique and need to be adjusted as conditions change. You may have to adapt and overcome. Likewise, there's no one approach to help all people be their healthiest. In a whole health approach, each person is unique. Care is geared to your needs and goals. You are at the center of care.
All right, how does everybody feel about that video? You know, how
Sounds
many-
great.
Yeah, it sounds great. I think it's a great video. I think it shows what whole health can accomplish. It shows the individuality of what is missing in medicine, right? And hopefully we can get back to it through this whole health approach. All right, well, let's keep moving on. So really what I wanted to show, so this video actually came from what's called the Whole Health Institute, and they are now a medical college in Arkansas and was founded by the Alice Walton Foundation. So really, whenever you look at the whole health approach, we kind of have to look at the history of it and kind of where it's going. We can't change medical schools right now, mainly because there's just so much information. The amount of change that would have to happen would be astronomical. So Alice Walton decided to build her own medical school. I mean, she's Walmart. She has all the money she can to build her own medical school so she can go out and make that change. But she's building this medical school from the ground up. They just took in their first cohort, so the landscape is changing is really what I think we want to show out of this. And the National Institute on Health. So whenever we talk about whole health and its origins and where it came from, we've been using this language for a long time. Whole health itself and that language has probably come about in the last decade or so. But really, whenever the National Institute really started this a long time ago, back in 1998, they did some research and started pumping out research grants around complementary and alternative medicine. Then that ended up getting rebranded over a decade later to the National Center for Complementary and Integrative Health. And then now they have an entire strategic plan around this that is around whole person care. And now they want to send out grants. Before, I'll talk a little bit about the grants. And whenever they rebranded, they got a lot of grant money and wanted to put grants out, because now the previous decade, they got all the information they really needed, right? They knew that these complementary and alternative medicines and therapies and different things was beneficial in the medical field. So in 2014, when they rebranded, they started pumping out more grants on implementing these complementary and integrative health modalities. So fast forward again another decade, over a decade, and now they are really focused on coming up with a strategic plan on the implementation of these new modalities in medical systems. So again, whenever you think about this rebranding and everything that they did, this is their model, which is a lot more science-y based, because they're a research institute at the end of the day. But if you look at it, they really focus on the whole thing and the whole person, all the organs, the tissue, and they separate it out differently. And then what happened later on was they came up with, so in 2014, like I said, they rebranded, but then they pushed out a lot of grants. And these grants went to VAs mainly, and VAs that had traditionally a medical school that was accompanied with them, right? And they were like, okay, now go out in Greater Los Angeles, you're going to do health coaching. While Biloxi, you're going to do chiropractic, and so on and so forth. And they were just pockets back in 2014 through 16 in these grants. And then what happened was they got enough information again, so they wanted to move forward with a systematic change. And that's where we kind of came in to the VA, was during this flagship site. So whenever, Todd was saying he kind of got onboarded, we were selected as one of the flagship sites here in Tennessee Valley. So what that really meant was, in this new system, we were no longer just looking at one modality within the complementary and integrative health modalities. We were looking at an entire systematic change. So they gave us grant funding, they did everything. They gave us almost everything except for a plan. They did not give us a plan whatsoever, because they wanted to see how this really rolled out, which was good because it gave us a lot of freedom. So now I'll talk a little bit about us implementing and kind of like an implementation case from that standpoint. So we knew that we were going to have to implement a lot of mandatory modalities, one being health coaching, another being chiropractic, acupuncture, massage, biofeedback, hypnosis. Basically we just expanded their entire care plan their services to include all of these complementary and integrative health modalities. So if you're a veteran, you are now eligible, and they have to provide you Tai Chi. They have to provide you yoga. They have to provide you these modalities. And if they don't, they're supposed to send it to the community. I'll say most agencies and most places aren't going to send it to the community. Maybe health coaching, though, might go to the community in the future as that's starting to grow. But I don't see a lot of those other modalities going to the community too often. That's not to say that they won't in the future. So whenever we broke this down, and Tennessee Valley had absolutely nothing in place. So whenever we started this, I had to think about, how are we going to educate the masses within this healthcare facility? How are we going to change the culture? How are we going to implement these, these complementary integrative health modalities and those types of things? So I really broke it down into education, clinical services, and health coaching. So we created the Whole Health Institute. And really what this was to introduce, teach, and train people to teach these complementary and integrated health modalities. So we wanted to engage veterans, staff, and community partners. And really all they had to do was sign a commitment to say that they would teach these modalities one time per week inside of wherever they met veterans or to employees, right? So really we focused on this, and inside of these, we ended up creating a Restore University. This one was a little bit more clinically based, but we focused on therapeutic neuroscience education. We focused on hypnosis. We focused on NADA and battlefield acupuncture, which is auricular acupuncture protocols, heart math, Reiki, biofeedback. So here you could come in and get these trainings and take it back to where you were able to meet your veterans. Then we were the first to have a 200-hour and a 300-hour curriculum for yoga. So we taught veterans, we taught employees, we taught community partners. We would bring anybody in and teach them these modalities. And again, the only commitment was they would go out into the communities and teach veterans this, right? We were trying to open up the doors to the community and vice versa, but also, you know, community is medicine at the end of the day, right? So if we have tribes of people that were practicing yoga, or we had tribes of people that were over here practicing Tai Chi outside of the VA and not having to come to the VA, that creates a healthier community of people, right? So that's really the big picture of what we were trying to do. And we really seen it come to fruition with Tai Chi, which Todd was a major, you know, factor in this. But we trained veterans in Tai Chi, and there was two spouses, a spouse and a daughter, I think it was, that was trained, and they lived 2 hours away in Cookeville from our catchment area. And they ended up starting a Tai Chi group at a church. I think it was a church. It might've been a chiropractic clinic, but they had a community-free clinic for veterans to come and have Tai Chi classes, right? So we didn't even know that was going to be a natural consequence of creating the school, but what a freaking powerful moment was having these veterans now having a place to go instead of coming all the way 2 hours. Well, it might not have been quite 2 hours. Cookeville was probably, they might have been able to do it in an hour and a half to get there, but you know, they were able to do it in their communities, right? So now we're making healthier communities. We also had mindfulness, mindful resilience for compassion fatigue, iRest, MBSR. We had different ones like that, and they were all train the trainer courses. So the whole goal too was to have people come back, and the next cohort would teach the next cohort, right? So it was a self-sustaining system within a operation, right? So this is its own ecosystem inside of your organization. So we'll talk a little bit later in this course about setting up wellness plans and things like that for an organization. And this is one way to do it, right? Is you need to think of how can you train the masses and create it as its own self-organism to where it just feeds off itself, right? And more people, the early adopters will come in, and then those early adopters will come back and teach it. And then it just becomes that self-sustaining system. Functional university. So here we started off with HIT University, high intensity interval training. And then we called it HIT U, right? We thought it was pretty cool. It was not cool. A lot of women got offended, domestic violence and other things, so I mean, in reality, it needed to change. We can laugh about it, but we never want to create that. So then we created Functional University is what we call it. And then everybody was okay with FU, right? Nobody would argue with that one. Everybody's good with that. So FU, we had Strong First, which is a kettlebell course. We had CrossFit. We brought in adaptive CrossFit trainings and things like that. So another thing that we did was we focused on functional fitness a lot. We actually brought TRX Connex boxes and put them beside our hospital so we could have, workouts. And every veteran, so how many veterans did we have on Austin and Armando? You actually are eligible to a TRX band. So you can go to primary care and say, hey, I need to adapt my exercises because of my low back pain or whatever. And they'll say, okay, and they'll put this in, and every veteran can get a TRX band. So that was part of our system, was we wanted to get veterans TRX systems and then teach them TRX so then they could be doing exercises in their home. Because TRX are these little bands right here for people who don't know, and you can hook them up to your doorways. I don't really recommend it. Buy an anchor and hook it up to a stud in your house. But, ultimately, these are great great things and great adaptive. The best part about it is a veteran will also get a free year app whenever you get your suspension system, or to their app. So they have all kinds of exercises on it and stuff like that. So, you know, these were the ways that we were approaching systematic change in that process. We also had a foundational course, which you all are getting ready to embark on, which is our Whole Health Coaching Foundational Course. We had it credentialed through the National Board of Health and Wellness Coaching, but we also credentialed it through the Holistic Nursing Credentialing Corporation. And this was an idea I had for sustainability and recruitment, because we know during the pandemic and other things, nursing is, well, recruitment in general became challenging, but especially in healthcare and nurses because they're getting burnt out. In the VA system, they get a cash advancement if they get credentialed through this credential right here. So they would actually get a pay raise if they did this, and it fit our model of what we were moving towards, right? Because we wanted everybody to be holistic nurses. We wanted them to look through this new lens. So all in all, it was a win-win. So that's the reason why this credential, you know, kind of came in afterwards, was that piece right there. So now that was my approach to that. Now we had to implement complementary and integrative health modalities. So what we had was we set up a clinic, and we wanted the clinics to focus on pain and whole health. So the clinic had a chiropractor and acupuncturist, a physical therapist, PTAs that focused on massage therapy and goal setting. I'll say the PTAs did targeted exercise too. So they were the ones that was working with you with your TRX systems. They were the ones that was doing yoga with you. They were the ones teaching you to stretch and do those types of things in your home. But this clinic was to really get you functioning more. So the results of all this, I'm not going to bore you with all this data, but ultimately, like I said, we started in 2018 with absolutely no encounters whatsoever. And before the pandemic really shut us down and those types of things, you know, we were the largest in the nation. Is really what I want people to show, is we went from being zero, we went to being nothing, all the way to everybody in the nation was now looking at us as the experts in this modality, which I thought is pretty cool in that process. And here goes coaching as a whole. As you can look, our coaching encounters, you know, we're far superior than everybody else's. And it continued to be that way year after year. Now this data, I'll talk about this data a little bit more. So if you're not a data person, you know, close your ears or whatever. So this right here is how you get reimbursed, this blue model. They are stop codes. So in a healthcare system, you have a stop code and you have to bill it that way. We focused on sustainability of this program, right? So that's what we were looking for. We didn't care about anything else. We wanted sustainability, because you can't have a program if it's not sustainable. Tampa here, this orange one is Encounters Char 4 codes. They focused on having more people in their system provide whole health data. So that's why you see that large yellow one there. Now, what the VA failed to do, like I said, they wanted independent models. In my opinion, where the VA failed was they didn't want to compare this data. I had to go in and create this data and compare the facilities. They didn't want any comparisons because we weren't on a standardization, I guess you can say. But how great would it have been through this whole process is if we're this sustainable and ours is bringing in revenue, theirs is looking at capturing data throughout the entire system. If we were capturing this throughout the entire time and having these conversations, the VA, we could have created a model here that could have been, you know, pretty unique. That could have been something that could have flooded the United States, right? But instead, you know, they didn't really have that communication among the flagship sites that way. And they didn't want it to be a competition. And, you know, in a way I get that, but I'm a very competitive person. So obviously I created my own slides that showed the data in a comparison because we had access to it and, you know, I wanted to see it. So later on, we did partner with Tampa once we did see the data, but here it just shows, again, every year, you know, we were one of the smallest in the country and then became one of the largest in the country. So we just continued to grow. Another thing was I wanted to create a dashboard that showed how much cost savings we had. Another thing that you all will probably hear me talk about, especially if we talk about the VA at all, is the VA is the only single payer system in the entire United States. They are the only system that is built to where they do not have to function like a fee-for-service mentality. Everything in the private sector does, because we have to pay for people's time. That makes it a fee for service mentality, right? Like you have, I understand it. In the VA, we don't have to be that way, right? It's only like you're not getting reimbursement in the VA. You're not doing those things. So why in the world are we still focused on it and the mentality that we're focused on productivity, RVUs, and everything that we do in the private sector? So what I wanted to do was create a dashboard that showed how much cost savings we were saving the facility if they were engaged in those whole health services that I just mentioned. So again, I'm not going to bore you with the data too much, but what I'll show you is whenever you break this down. And another thing about this and why this is so important in this single payer system, we were a VERA category 4, so we were in between here. If your veteran fell in one of these higher categories, then you did not get reimbursed for your services. So they were dead services, as you would think, to a hospital, unless it was a cost reduction service. So again, probably boring you with a lot of this data, but I wanted to show you that. So veterans who were engaged in our services at least 10 times, so saved the hospital on average in this category $10,000 per patient, right? And then over here, if they were engaged in our services, on average, we saved the hospital over $10,000 just in these two categories. And this was medical, psych, and substance abuse. So if they were engaged in that, another thing that we found in this data, is that veterans were 6 times more likely to show up to their appointments if they were engaged in whole health. So again, somebody who's invested in them a little bit more, looking at them as an individual, they showed up. So now the national data just showed a lot of, veterans were engaged. They had mental health diagnosis, chronic conditions, chronic pain. And then, of course, this was born out of the opioid addiction crisis. So it shows that everybody that was engaged in whole health services had a reduction in opiate use. And, just something to think about as we're moving towards this. So as you all are jumping into some of these roles and moving in towards health coaching, it's important for y'all to know that health coaching and the benefits of this and the way that you can present yourself, right, is if you are working with health coaches, then you more likely than not, if they are in psychiatry, if they are in mental health, they are more likely to show up to their appointments. They're going to have less costs, less no-shows, less everything, right? The data shows it, it proves it. And then here in the psychiatry world, where we have a mental health crisis and people can't get in, right? If we could have people show up to their appointments more, not no-show them and all those types of things, then we could have, well, I won't say we'll fix the mental health crisis because that wouldn't fix it, but we could have people be more productive with their time, right? Not having no-shows, last minute, cancellations, things like that. We can reduce all of that within this piece. And of course, this shows the reduction in cost in general, just in money. Rehab medicine, you would imagine with chiropractic and yoga, physical therapy, the things that we were implementing, it definitely helped more with rehab, but it definitely helps a lot with the psychiatric side of things, right? We know that meditation, mindfulness, mindful movements, different things like that definitely help being able to move forward. So now jumping into, now we took everything that we knew within that model and we threw it into a small piece of our facility. So this RRTP program is a 90-day treatment facility. You have to have a dual diagnosis of substance abuse and PTSD to be in this treatment facility. And trying to think of anything else as far as the background. Historically, actually, I'll go ahead and say this. Whenever I first started working here, this is how bad our RRTP program was they released a veteran prematurely. He wasn't necessarily compliant. He wasn't violent. He wasn't anything. They released him prematurely. They were doing construction on the RRTP in the back, and a veteran went into the construction site and hung himself. They literally walked him out of the door. I don't even think the guy's dad was there before they even just basically shut the door on him and left him there. And then he went back there and hung himself. The reason why I say that is there obviously was a major overhaul of our RRTP program. There was construction going on. There was that suicide that happened. I will genuinely say I was a part of some of that investigation, and absolutely it was neglectful on the VA side. I mean, it was proven, it was in the media, the whole nine. It's a very tragic situation. It happens in healthcare. I'm not trying to condemn anybody. It happens on a regular basis. It just, it shouldn't have happened in this situation for sure. So anyway, we were going to rebuild it. So we focused on that entire model that I just talked about. We put everybody in the RRTP through this coaching course. We put them in yoga courses, Tai Chi courses. We put them in acupuncture courses, and we trained them in everything. And we were really trying to bring this residential treatment facility up to the 21st century. Because if you go into a private sector treatment facility, a lot of times they're already having yoga, right? They have a meditation room, they have these different things. I'm not going to say all of them because some of them are most certainly still shitty and not good across the board. But the private sector does have those things, right? They are having healing centers and they're focused on the healing environment of things. So we're really trying to bring it into this 21st century. So we trained them as health coaches. We trained the leadership. We trained the leadership to start meetings with mindful moments. We just did everything. We changed the entire culture within this. We implemented all of these modalities from the NADA protocol, which is that auricular protocol for addiction, yoga, IRES, mindfulness. We implemented all of these. And then what ended up happening out of this, that's off, but we made national news. We ended up getting an exemplary notation by implementing this in the RRTP. And what that really means is, and as accreditations start to roll out, you have to have standards and pre-standards to hold businesses accountable and healthcare organizations. So like CARF accreditation, which really focuses on rehabilitation. So we went through that process to get this facility CARF accredited. The surveyor came in and we had no notations whatsoever, but we had 2 exemplary notations, meaning we did 2 things really great. And one of those was they noted that we had a comprehensive whole health initiative approach of healthcare, and that we just didn't focus on the veterans, we focused on the employees as well. So all the trainings we put them through, they were going through health coaching themselves. They were able to engage in yoga. They were able to engage in Tai Chi. They were able to engage in all those things. But these are the things that we need from the system to be able to set us up for success, right? Because now that we have these standards, moving forward, CARF can now start holding people to a certain standard of saying, hey, wait a minute, here goes a bare minimum standard of what a whole health system would look like. So these are the steps that we need to take to be able to move forward. Now I'll stop here before we kind of move on, but does anybody have any questions about this part? Comments? Too easy. So why do we think we need patient-centered care? So now that we've heard all this, you heard me ramble about that whole case study and kind of getting to this point. Why do we even need patient-centered care?
I would say it's so that patients are getting more time paid attention to them and their individual needs.
Yeah, so more attention on them, more individualized attention, really, because on their individualized needs.
Yeah.
Absolutely. Absolutely. But I'll show this video. Hopefully this one will play because this is a good one. There it is. I'll just pull it up over here again. So this video, in my opinion, is a great video.
Are you ready for this? I have been to the ends of time and back. Never seen anything like this before.
You're muted, Charlie. There you go.
Yeah, no, I was letting that ad go by. I didn't want y'all to have to listen to that ad. All right. what's your thoughts on that video?
I think it just shows that every person's different and everyone has their own unique scenario that they're going through, and that there's no way to really know unless you ask or they tell you.
That's right. You don't really know what people are going through. And definitely is a powerful video in showing that, right? Because all of them look normal. You know, you think you see somebody walking through with a benign tumor or malignant tumor, and you're kind of walking through, you expect them to be stressed out. He kind of looked a little bit stressed, but you know, some of those folks are just normal people showing up to the hospital and have all kinds of stuff going on.
And just to add to that, Charlie, I think it just highlights how important it is to honor patient preferences. You know, I think sometimes the medical professionals, they get a very narrow view on what should be done and don't hear what the patient wants.
Absolutely.
I think that's a really good point. I think oftentimes you get so caught up in like textbook things that you forget that you're dealing with like a real person who has like real life experiences that you can't like understand that fully through the textbook lens. So understanding their perspective is really important.
Yeah, with different backgrounds, with different religions, with just, you know, it's very individualized. What I believe my treatment options should be might not be the same as somebody else. And so at the end of the day, it needs to be very personalized, and you need to hear your patients and offer them all the options. And I think that's one of the things that was difficult sometimes with being in nursing, was it might not have been necessarily what I would have done, but you give the patient all the education that you can, all the pros and the cons, and you allow them to digest that and come back and make their own decision, whatever that might be.
That's right. You know, we don't know what's going on in their lives, and yeah, it could be religious barriers or values that are so, you know, so rooted in their history and who they are that they don't want to do certain things. And no matter what you talk to them about, they're not going to do those things. So most certainly, I think, and definitely to Kirby's point is we can look at the data all day long, and we can use the data as a guide, but it does not replace the individual that is standing before us, right? We can say, okay, on average, you know, 55-year-old African American males are more likely to have diabetes. So should I give them diabetes education? Potentially, right? Give them that education, but you know, that's not sold that this 55-year-old African American male in front of you will get diabetes, right? So, you know, use the data, but treat the individual, right? I think that's really the big picture. All right. Anybody else? I thought I heard somebody unmute. Anybody else got anything? Okay. So kind of going into it, you know, I always show this. So recently they came out with more data on the life expectancy of people in the United States. So whenever you look at this, you see the average age of life expectancy, and then down here you see the country. Now this blue line is the average life expectancy. This solid line going through here is the cost per capita in spending, right? So your GPD or GPT. So whenever you're looking at this, is how much you're spending. So whenever you look at this, what's crazy to me is the United States obviously spends the most in healthcare out of any other country, right? We look at this, and more than any other country, we spend way more than them, right? But then we look at the next fact is our life expectancy. The CDC just came back out and it went a little bit up. We think probably because of COVID more than anything, but it did go a little bit up, and now is at 77 point something years is where we're at. So let's just say 77 years for good math. We're at 77 years, but we spend the most out of any other country. Like the most that we spend is almost the average age of what Japan is. Like that's crazy to me whenever you look at these numbers. And then the other part that drives me crazy is we look at Cuba, who spends the least out of all these countries by far, and then their average life expectancy is almost the same as ours. That's tragic in my opinion, right? Like that is like just imagine where are your taxpayer dollars going right now in healthcare systems. If we're spending this much money, but we get a poor return on our investment year after year, and we haven't changed much of anything besides advancing different types of specialized procedures, right? Heart ablations to, all these things. We can advance healthcare that far, but we can't keep people healthy enough to where they can live and have a long, healthy life. And the bad thing is if we look at this data and we really break it down and we look at the metrics that people work off of in coming up with these, we suck at every single category. Right? It's not just that it's like one area where like, oh, we just spend too much money and we just eat too much. Like no, life expectancy at birth, we're terrible. Infant mortality, we're terrible. Right? Quality of primary care, we're in the middle, but as much as we spend, should we be in the middle of that? No, we should be all the way over here. And then we look at diabetes. We should really be managing diabetes a hell of a lot better than we are with the money that we're spending, but yet we're terrible. So whenever we look at this, why is it changing? It's because we failed. We have failed drastically to implement a health system that can push us forward and focus on individual care that is equitable, that is fair, that is, equal across the board. And we just have failed to do it. And even in the VA system today, we have still failed to do it, even though it is changing. It's still disconnected. There's so many different models. People say if you've seen one VA, you've seen one VA, because there's no standardization across the board. And I'll say that in any healthcare system, that wouldn't be just the VA. If you for Colorado folks, UC Health is a big one here. If you walk into one, you're probably going to walk into one, right? They're not going to be the same. The providers are different. Even whenever you look at the healthcare side of things, it's individualized because individuals are the ones that are providing the care. So we have to think of it even whenever we're walking into the healthcare systems that way. But we are drastically failing and we are drastically looking for an answer. And I do think this whole health approach is a great answer. And in my opinion, this is the most solid definition. Probably the only thing I would maybe change about this definition is change approach to philosophy. But whole health is a philosophy to healthcare that empowers and equips people to take charge of their own health and well-being and live their life to the fullest. To me, that is one of the best definitions, right? Because ultimately it's about that individual and it's not what's a matter with them, right? It's what matters most to them is really what we're working on. And especially in the health coaching realm. Now you'll see all different kinds of systems. I won't bore you too much, but ultimately the VA system is they want to create a personal health plan that is at the center of your care, that is personalized to you. And then they have these different these different sections that also is part of your care. Clinical care, no different than anything else. The pathway, which is really where health coaching thrives right here. But they also thrive right here in the middle. They're the ones hopefully coming up with that personal health plan in most systems. It's probably not there yet, but that's really where they thrive, is this green and this blue. And then this well-being programs over here. This is where your yoga and other things fit. You see health coaching down here. I don't agree with that. This up here is where it really falls. Todd, if he disagrees with that, he can, I don't think it's a well-being program. It's the pathway, in my opinion. But I added these other ones up here. So, you military folks, the military's already been equipping the same thing or adopting the same thing and already deployed a lot of these different pieces. You can see they have literally the same, plus this equals this. The DoD has implemented this. You'll actually see the VA Circle of Health inside of the DoD standards, which I don't have. I thought I had that one pulled up. But anyway, you'll see it out there. Here is another one with the Total Force Fitness within the DoD. But you can literally Google the Circle of Health and you will pop up 100 Circle of Health. So there's so many out there. We'll be using one in this course. You don't have to use that one. There's so many different ones that you can use. But ultimately, everybody's adopting it. This is going to be the new system that people see in healthcare, I hope. And I hope it evolves. Like I said, the NIH is going to hopefully start holding people accountable to it. And even JCO and CARF accreditation, all these accrediting bodies will start holding people accountable to this whole person approach. And it all starts with being able to name it. So we'll jump into this and then we'll take a break whenever I finish, and then we'll jump into something else. So if y'all need a break, we'll get one here in about 20 minutes. All right. So lifestyle medicine, this is another one, but this is really starting to lead the nation. They have an entire fellowship and other things, but it's ultimately the discipline of studying how daily habits and practices impact you, right? And impacts the treatment and prevention of diseases in the future. So whenever you look at this, the lifestyle medicine folks broke this down into these 6 domains. And, you know, it's really looking at daily habits. Now, this is one that I find to be one that I like to talk about the most. This one is the illness wellness continuum. So there was a study and they did a lot of research on this. And the biggest thing that they found out about this, right? You have 2 arrows, one facing premature death and the other one facing high level wellness. And what the research showed is it didn't matter where you fell on this continuum, it mattered which way you were facing, right? Because whenever we hear the miracles of somebody getting some, stage 4, cancer and whatever, and they survive, well, they were facing the right direction, right? More than likely. And whenever I say facing the right direction, this kind of goes back to what Armando was talking about with that, that biopsychosocial spiritual model, right? Kind of, if they're facing the right direction and they're working on those domains, and they're doing that, they have a lot better chance of survival and living a long life than if they were facing the other way. They get that diagnosis and then they immediately start to, get depressed. They start to face their own direction, right? They're not taking care of themselves. And again, there's some discrepancies with this because you look at disability over here, in my opinion, people with disabilities doesn't necessarily have to always fall right here, right? So there is some flexibility and some flaws within this, but ultimately it's about the regular treatment paradigm gets you to here. I'm a mental health therapist, like I said, by training. In mental health treatment, I give people a diagnosis. We come up with goals around that diagnosis to get them back to where they can function to a normal status, right? Back to this neutral point, and then I discharge them. That's the traditional medical model. That's how every medical model is, right? You go see a cardiologist because you have high cholesterol. If you fix your high cholesterol, they get you on some meds, they discharge you, right? They get you back to normal and then you're gone. Well, the wellness paradigm gets you all the way through to this other side. And that's where health coaching thrives as well, right? Is we're going to walk alongside of them through this entire process, and we just don't release them whenever they get here. And you could say that this, we just don't get them back to normal, we get them back to thriving. So we focus on thriving. This is the regular treatment paradigm. They get them back to normal, we get them to thriving. And then this is just a good place to kind of go in and look up research. You'll get these PowerPoint slides. It's a great place to just go in and be able to look through. But whenever you come in here and you start going through it, I'm not going to bore you with, because you're not going to remember how to find all these things. But you can go in here and it'll give you all the evidence-based treatments and things like that, and different things that you need for physical activity, different types of things, but also in here it gets into health coaching. So, oh my gosh, we're gonna have to take out some of these slides. I don't think they need to know all of this. But you can come in here and you can really start looking up all this data. So if you are a data nerd and you really want to get in here and look it up, it is good to get in here and really start messing with these healthy people for 2030. But one thing that I want to add in here whenever you get through this, I feel like we have the same slides over and over again. Okay, so social determinants of health. So this is where I'll stop. Or not stop, but kind of go through that. So you can come through here. It has all kinds of things through there. But now I'm going to talk a little bit about the social determinants of health. So whenever y'all hear the social determinants of health, what comes to mind for you all? I feel like it's been a buzzword. Money, yeah.
And social network, like friends, community.
So community, most certainly. Community is huge, right? we know we are social creatures, and even though people want to isolate and go do those things, we know it's not good for people, right? So social community and definitely finances. I forget who mentioned finances earlier, but financial health is huge. Yeah. It causes all kinds of stress. So
I think another big one, Charlie, is education. I've been to places where we understand the importance of just simple washing your hands, right? And I've been to other countries where it's like the education isn't even there for something just as simple as, hey, after you go to the restroom, you really should wash your hands with warm water and soap, right? And so, an education is definitely a big one up on there,
yeah, and how long should you wash your hands for?
right? Sing your ABCs,
Right.
right?
You should be doing it for, 20 seconds, right? I think 20
Right.
seconds is the minimum or something, so people don't know those things, right? So, and I know probably like Austin probably never washes his hands, but
I didn't even know that there was a timeline.
exactly. See?
Yeah, live dangerously. It's okay.
Yeah, I
I
shared
thought
a
it was a
roomie.
minute, so I've been overdoing it this whole time apparently.
No, I mean, I'd say the research goes back and forth on it, I'd imagine, but I'd say 20 seconds would be a minimum. Go ahead, Todd.
I don't remember what they said back in 2020.
And the
A
whole
lot of
washing hands
conflicting.
things.
Yeah.
I just say eat more dirt, helps the
Eat more dirt.
immunity.
That's right. Eat more dirt.
But we talk about the social determinants of health, and my mind goes automatically. Earlier you talked about the doctors and stuff like that. Someone goes to the doctor. We're in rural Tennessee, and the doctor tells them you gotta eat better. You gotta get more fruits. Stop eating processed foods. And that individual, there's $7 generals between that doctor's visit and their house, and there's not a damn place that they can find fresh produce.
That's right.
That's, to me, that's what I go to in the social determinants of health. I mean, where you live has that access to things, has that impact on all that different stuff.
Yeah.
And do you have the money to buy it, right?
That's the next one. That's what I was getting ready to say, because it's buying fresh food is expensive, right?
I
So,
feel like a lot of them just really do tie back to economic stability, where you have access to boils down to how much money you have a lot of times.
I would agree with that. I think because you can be healthy if you can buy it, right? If you can pay for a
Yeah.
personal trainer, right? You can stay healthy if you can buy all those fruits and avoid the dollar menus and and all of that. But if you're a single mom of 3 kids, are you avoiding that dollar menu? No, you're probably hitting that up because you're on the way to some appointment and too busy to cook, because whenever you get home, you can't cook. All those types of things. Ozempic. Oh man, Ozempic is the rich white lady's drug right now. Um, and I think it's a great drug. I don't want to take anything away from that. I think it's needed. I think it gives people a kickstart. I think it's being abused by all means, but I think it would be great if you combined it with things, which we'll talk about a little bit later. I won't jump into it now, but I'm always looking to answer these social determinants of health. Actually, I'll go ahead and jump into it. So, um, I ended up purchasing a gym, a personal trainer gym, and my goal is to turn it into a Medicare clinic that prescribes Ozempic to people of vulnerable populations, people of lower socioeconomic status, and those types of things, and Medicaid. And then I also want them to be in the gym working with personal trainers / PTAs. And then I want them to have a mental health counselor that will be working with them on hypnosis for weight management and developing healthy habits. And then I want them to have a health coach, right? Because Medicaid and Medicare will pay for health coaching. Well, it depends on Medicaid, but Medicare does for sure. And then I also want them to have a dietitian because they pay for all that, right? So if we have an entire team that can focus on that, and we do it and pay for insurance through Medicare and Medicaid, right? We have therapists inside the gym doing yoga with them because it's part of their scope of practice, right? We have, all those types of things, and it's completely free to the patients. We need more clinics like that, right? So, and then we need to do it in a holistic manner. So there's ways to be able to do this, is basically what I'm saying, and answer these social determinants of health. And And, you know, us as health coaches have an opportunity to do that. You know, Todd uses the example, that is a great example, and I'm probably going to steal that. I don't think I've heard him say that one before, but, you know, the one I always use is the doctor that tells the old 72-year-old woman that she needs to walk more, and she lives in some, you know, some tiny apartment in downtown Nashville or downtown Denver or whatever it is. And, you know, if some 72-year-old woman is walking in some of those neighborhoods, for one, they might not have a sidewalk, right? And if they did, then there might be a lot of crime that can make them a victim, right? So you also need to know where they live. You also need to know those types of things, right? Because ultimately, you know, you could tell somebody to go do something and you automatically increase them of being a victim of some type of crime drastically, right? Of just telling them to go walk in their neighborhood. Right? So it's things that we have to think about. But you know, one thing that I genuinely think about whenever I think of the social determinants of health is we spend 90% of our lives within 5 to 20 miles of our lived environment. So your home, you typically spend 90% of your life within 20 miles of your home. So keep that in mind, right? So we know we spend that much time in our built environment. And we know that in a society, I don't know how many people have focused on the Blue Zone research. There's a Netflix special on it, but there's all kinds of research now coming out on blue zones. And what blue zones are is they do a lot of research on places where there's a small group of people that live to be 100 or more, right? So there's outliers across the country or across the world, and they measured it, and they were like, well, what all comes into that? And one of the biggest pieces that they found was community and social network, right? So I think it was Kirby said that about the social piece, right? That's another big piece, right? We know it, and it shows it not only in the research, but people who have long lives. I think one of the places was in Greece. They literally drink wine every single night, but they were a community, right? And they had people that lived to be 100, and they walked everywhere they went. They, you know, all those types of things, and they were just a community. And you know, if I just find this funny because if we know social and community comfort helps longevity, we know that you live 90% within your lived environment, but yet we focus on the primary care and the professional doctors and physicians and the professionals in our life that only make up less than 10% of our time spent, right? So why in the world are we so focused on their expertise whenever we know us just having a community and living in our lived environments help us live a long and more fulfilled life than anything that that physician's probably going to tell us to do. So I'll ask you all that. Why do you think we focus on that primary care visit, even as an individual, more than we do on our lived environments?
Money. It's easier also, I guess. But yeah, people make money off of that, and it would be really hard to change.
Yeah, people make money off of it, but also what I heard you say was it's easier. You're absolutely right.
Yeah,
It's easy. It's so
but
much easier to show up to your doctor and then put you on a statin for your cholesterol than get into the gym with Armando and have him, you know, yelling and screaming at you, right?
it's also like societally hard. Like we can't change the way that our cities are structured. Other countries have walkable neighborhoods, and we don't really have that. But we do have doctors, good ones too. But you know,
That's right. But you know what's funny is your city will spend more money on bringing another hospital there, right? Or an expansion on a hospital than they would to create more walkable walkways to get to downtown or something, or you know, because I know in that Blue Zone Netflix special, I think it was Minnesota. It might have been actually Wisconsin. I can't remember. It was somewhere up north. And then they completely redid an entire city to where they spent the money on having those walkways. They did everything like that. The bikeways, they put gym equipment in their uh you know, along the walkways, but in their parks and stuff like that. And they increased the longevity of that town and people who live there on average. I want to say it was by 4 years. Again, I don't have those numbers in front of me, but it increased just by increasing their environment. So you know, again, it's just funny to see where even whenever the research tells us it would be better to do that than it would be to expand our hospital, because if people are healthy, they won't be in the hospital as much, right? So we free up access by making them healthier by walking, you know, downtown and doing all these different things.
Well, and Charlie, it's an expectation. You're expected to go to the doctors. You need to go to the doctors. You need to follow up. Then you need to come back for a different type of Medicare exam. Like,
Yeah.
you know, you're not expected to go downtown and go for a walk and go to the gym. That's not an expectation societally here, but you are expected to go to your doctors and listen to what they say.
Oh no. Yeah, I agree. I was reading what Kirby put. I agree. It is the expectation, right? It's the expectation that you go to the doctor. And the unfortunate expectation is the doctor's expectation to find something wrong because they have to bill for that. So they have to find something wrong, right? Like they can't bill for it. So if you're completely healthy and you show up to the doctor, like what would they bill that for, right? And even if they did, it would be a minimal bill, wouldn't it? It would be, you know, I don't know if y'all know this, but primary care can bill multiple codes at one time. So, you know, if they only built one code, they wouldn't be able to keep their doors open, right? So they need people to be sick as well to keep the entire economic model moving. I'm not a conspiracy person, so don't think I'm thinking that there's some man behind the wall. Yeah, Todd.
All right, I am.
Yeah, Todd can talk about those. I genuinely think we don't have the answers. That's what I think is going on. We don't have the answers. We don't know how to change the system. You know, if you think about it back again, going back 50 years ago, well, probably more than that now, 100 years ago, you had a doctor who would carry their little black bag and treat your entire family. They'd come to your home, they do your entire checkup. It's almost like the mailman, right? Then they go to the next house. And back then they took care of the entire family. They were delivering babies. They were checking on your baby the entire time. You know, they were the ones, right? They were the ones, unless it needed to go somewhere else, and then they would send you out. But that person knew who you were. They knew that your lifestyle would not meet, you know, whatever they're telling you to do, right? Or they knew the entire system of who you were. And then we took that out. And then the real reason why we took that out is because of transference and countertransference, right? Is physicians were getting burnt out because these people were dying. They were too close to these people. So then we pulled the physician out, and then we started to tell physicians that people were only diagnosis, right? You shouldn't get to know them because it's going to hurt your mental health. And then we built an entire medical system over 100+ years of that once we did that. And now we're working so hard to put the community back in, but we don't know how to go backwards. And I do truly believe we have one hell of a great healthcare system that can treat. I mean, people come here for our cancer treatments. People come to our country for all different kinds of specialized treatments. But what they would not come here for is our preventative healthcare services. But if we could find a way to mix something like the way that Japan and even some of the tribes in Alaska and some other tribes, they bring the community into their hospitals, right? That's part of it. You drive down the street in China or Japan, and you see people doing Tai Chi in mass forms. You can see that in San Francisco, actually, right? And in just even smaller places of their communities. But you see this in different places. And if we could merge those two philosophies, we would have one hell of, because again, I'm not saying we should do away with some of the great things we've done in healthcare, from the open heart surgeries to the removing of different tumors on people's nervous systems and brain cancers, and, you know, all the things and advancements that we've done. We don't need to do away with that. What we need to do is go back a little bit and then start focusing on preventative care, and then use our taxpayer dollars to focus more on that preventative model. But of course, that's a huge shift that people just can't see, and they don't know how to make it happen. And you know, again, I'm not blaming anybody. I'm not that conspiracy person like Todd and Schnazana. That's it, isn't it? Is that it?
Snezana.
Snazana.
There you go.
There it is.
Am I having
No.
a stroke right now? What is happening?
I love
I'm
it.
trying to get these names down. I hate messing people's names up. It really drives me crazy. And I talk funny anyway and mess words up on a regular basis. And
That's great.
and then you know, so I try to do it. But anyway, so common chronic diseases, I won't go over this because we're going to talk a little bit more about diseases and other things, but you will need to know these for the health exam. So whenever you go take the exam, there is going to be biometric data. You will need to know these things. You'll need to know, blood pressure and those types of numbers. But these are the most common chronic diseases that you would end up working with if you worked in chronic disease. Heart disease, we know that's the #1 killer, right? Cancer is complicated. Even if it is curable cancer, it's going to be complicated care, right? For people who don't know, there is a major difference between treating pain-related disorders and cancerous pain. Every hospital, every clinic, everywhere will always distinguish between the two. And the reason why is because obviously there's a lot going into the person who's having cancer treatments and those other pieces, but you can work with them. And then also diabetes. Diabetes is obviously another large killer. Our country is drastically obese. And that in my opinion is one of the root causes we could almost fix as a community if we could just work as a community, get walking paths. I know some places, especially living out in Colorado now, I know that there's a lot of places out there that can't get to a hospital or a clinic very fast at all, if at all, especially during some times of the year, winter, I mean. So, it's something that we could definitely help out as well. Looking at the literature with coaching, again, I've talked a little bit about the data, but the data continues to come out time and time again, and that is why this is now a reimbursable model, which Haley will talk a little bit later. It's a reimbursable model because of the data that was put behind it. The work that Todd and some of the other folks are doing on the ground at the VA led to the research that is allowing this to be a reimbursement model. We'll talk about this towards the end of the course. We just had a course in, so it just makes me think about it, is there is roughly 10,000 coaches in the United States right now. And that's after this last exam. This is still a new field in being credentialed and being held accountable. And we are all on the ground floor of all of that, right? So we are going to be the experts in this in the future. And the research is showing that it's going to continue to be great. It's going to continue to be a reimbursable service. Right now, it's specialized reimbursement with Medicare, but it's going to be moving into a full-on service right after this, right? That's just how the progression works. And then next thing you know, most Medicaid programs will probably pick it up right away. And then in private insurance will pick it up after that. Of course, it'll probably be a benefit that may or may not happen in some insurance packages like chiropractic care and things like that at first, but we'll just see how it progresses. But I think it will progress whenever we have a field of, 175,000 health coaches in the field. You will see a drastic change in what that kind of looks like in the reimbursement models, but we're on the ground floor of it right now. So, and out of those studies, it really just talked about how, health coaches being trained in everything that y'all are about going to be trained in, setting these goals, and accountability. Ultimately, people need accountability is what they're paying for whenever they're paying for a health coach. As a fitness instructor, right, that's what they're really paying for, is they're paying for accountability and of course some expertise, right, knowing how to do what you're doing. Fitness instructor is a good example, right? If you do military presses a certain way, you might hurt your rotator cuff, so you got to be able to teach people and walk them through that. As a health coach, you're facilitating a conversation to help them come up with their mission, aspiration, and purpose and set goals. So that's your skill set that you're bringing to the table here. And again, all the literature that really shows all of these right here, health coaching helps with, right? And helps move people in the right direction. Whenever we talk about that illness wellness continuum and people, we look at these issues, these are killers, right? So these two right here are pretty much silent killers, right? That if you have a lot of stress in your life, you're going to have high hypertension, and you can't get that time back whenever your heart is really stressed out. So, these silent killers here is another big lookout, but we help as health coaches with all of these. So any questions as we take a quick break, and then I turn it over to Haley, I think. So any questions about any of this? Any comments? I didn't put this or say this, but Kirby put in the chat that she lives in a walkable neighborhood in Memphis, but then the sidewalks aren't even walkable. So there's a good example, right? You might even think that they have a neighborhood that they could go walk in, and then in reality, they can't walk in it. And then think of, an elderly person walking on something that you can't walk over, then it's a tripping hazard, right? Then it's another health issue that you got to worry about, broken bones, fragile, all that type of stuff. So anyway.
Charlie, what I love, just kind of not funny, but hearing docs telling like the elder, oh, go walk, and it's in the middle of the winter. Like, okay, how are they gonna get there? Where are they gonna walk? Like, do they have the money to buy a treadmill? Like, none of those considerations came into play. Just, you need to walk more. Okay.
Yeah. And I will say another major issue with healthcare came whenever Medicare changed the primary care appointment to 20 minutes. Well, really all appointments. They came up with the
Yeah.
20 minutes. So then providers only had 20 minutes with you. And again, it was that data decision that didn't focus on individuals, right? Because it takes longer than 20 minutes to know an individual, especially if you're only seeing them once every 6 months. It'd be different if you were seeing them weekly, right? Then maybe 20 minutes would work better. But no, 20 minutes once every 6 months is just crazy, or sometimes once a year, So if something happens in that year and your health declines, that's a year before you talk to anybody. So it's crazy.
Psychiatrists are like that too.
Yeah.
Like a 15-minute session every 3 months. And they every time will change your medications. It's like, how you don't even know me.
That's right. Psychiatry, in my
Let them
opinion,
have to
works.
stir it up, and then you got to leave.
That's you guys. That's why they call it practicing medicine. Come on now.
Because they're practicing. That's right. But if you're sitting there, I think mental health is the biggest place where we see the biggest crisis, because that's another place. If you wait 6 months and they tweaked your meds, right? It's a huge gap between, right? Because it takes 2 weeks for the medication to settle in, roughly, right? But let's say it takes a month to settle in. That's 4 to 5 months that you're sitting there if that medicine is making you ill, all those other things, or it's just not working. And then we wonder why people go off their meds so much.
I feel like at that point you don't even know if the meds are really working. Like the frame of reference is too far detached almost.
I agree. All right, well, let's take a 15-minute break. For those folks, I'll always use Mountain Standard Time just because that's where we're at. Come back at 10:50. And then we'll jump in, and Haley will talk to us a little bit about coaching now that we've learned a little bit about whole health. I feel like Todd is waiting for the flood or something. He put on a raincoat.
It's a hoodie.
Oh, okay. It looked more slick from over here on this side.
Waiting on a flood. What the heck? Okay, welcome back. Hope you had a long enough break. Just to throw it out there, if you ever need to take a break or walk away, grab something to eat, whatever, please feel free to do so. Don't hold it and hurt yourself, or not go get something to drink when you need it. Pass out, because there's no way of us helping you out. Okay, so let's jump into what whole health coaching is. So after everything that you just heard Charlie talk about for like the longest time, what do you think? Just wanted to see him spit out his drink. What do you think whole health coaching is? In your own words, just throw it out there. What is it to you?
I think it's individualizing care from all different aspects, from health, wellness, mental health, financial, community, family, spiritual, and individualizing the care to that one person's specific needs.
Okay, so individualizing care across the board, it sounds like. right?
Correct.
I was gonna say, I think it's like when you're working with somebody and you look at all the different aspects and like focusing on each of them with that individual person to like improve their overall whole health, if that makes sense.
Does, absolutely. So improvement overall and kind of letting them take the lead. I heard that.
Yeah, I was kind of thinking just allowing the individual to be in the driver's seat of things and really seeing what their whole health looks like and what they want it to look like and helping support in that way.
Yeah, in the driver's seat. I mean, that's truly the key. They're the ones kind of telling you what they need, right? Versus me saying, you need to take your pills, right? How effective is that? Armando, I think I saw you unmute as well earlier.
I mean, it was pretty much the same. But going off the, putting them in the driving seat is essentially just being that guidance there. But just kind of being the barriers on each side. So not telling them what to do, but kind of giving them that guidance, the GPS essentially to the end goal.
I like it, GPS. So that's actually along the lines of what I usually say too. It's kind of like you're holding the map and basically kind of helping to guide them down the path, but they're telling you where they want to end up, right? They're telling you, I want to make a pit stop here, here, and here, and I want to ultimately get here. Can you help me get there? And we're just kind of right there beside them, talking through it, right? So that's perfect. GPS, I like it. So if you wanted to get a kind of just a general good definition, here it is for you. Assisting clients to realize their own health goals based on their lives' mission, aspiration, and purpose. We call this their MAP, their mission, aspiration, and purpose. So if you hear us refer to their MAP, that's what we're talking about, okay? So here's some thoughts of coaches in the past. Who wants to read this one for me? I can't ask Charlie. I can't ask Todd because they can't read, but maybe one of you guys.
I'll read it.
Okay.
Thoughts on coaching. Because healing is a process, the metamorphosis of the role of doctor to healer is the change from doer to helper, from expert problem solver and fixer to servant and companion, and accompanier on the healing journey.
Exactly right. Thank you. So you're not fixing things, right? From what that says, you're not there to be the ultimate problem solver. You don't have to know everything to be a coach. What we're there to do is help guide down that journey, down that path, and help them to truly decide what it is that they want out of their health and wellness. I mean, that's the scope of it right there. So Harvard Publishing had this little quote from Dr. Peter Grinspoon. I think I just like to say his name, Grinspoon. Seems like a cool last name. So he said, unlike health fads that come and go, health coaching has strong evidence behind it, backing its effectiveness for improving health and well-being. Becoming a health coach has been deeply rewarding to me because it is rare in life that you get to promote happiness, build resiliency, save people money, and help people live longer and more fulfilling lives at the same time. Ultimately, meaning his experience as a coach has broadened his scope of knowledge as far as it comes to helping people out, helping them to achieve the goals that they want to achieve. So when you dive into this health and wellness coaching journey, think about it as you kind of build your skill set on what really drives you. What is it that gets you up in the morning and helps you to help lead other people down that path, right? Because that's what's gonna kind of help push you throughout this journey. So there's two distinguishing features when it comes to coaching. One, the belief behind integrative health coaching is that behavior changes of the person you're coaching are sustainable when linked to the person's value and sense of purpose. So hearing that, what does that mean?
I know, Haley. I know.
It's essentially, I would say, there's a word for it, but I can't think of the word. But essentially, it's saying it there, like their personal values and sense of purpose. So they're gonna do things that they value. Like people don't do things that they don't see any value in, that they see themselves in there. So when you can include values and you can include things that they like to do or things that they find interesting, you're gonna have behavioral changes because it's something they like to do. But so you're not gonna get the opposite. You're gonna get the opposite if you're not interested in something, and that's why people always struggle to like learn things or do things because it's not something they want to do, or they find no value in it. So you gotta have to show that value or that sense of purpose
Yeah.
for that.
Yeah. So we can easily use your career as an example, right? So you train and coach people, right? In the
Yes.
physical sense.
Mhm.
All right. So if somebody comes in there and they want to be trained and they're like, I'm going to drop 100 pounds, do they usually follow through? Do they show up the next day if you just have that conversation? Nothing else around that. Just I'm here to lose weight. Are they going to keep showing up and lose all that weight, you think?
No, you have to dig. I'm skipping ahead, but you have to dig in deep and find the reason, um, the emotional reason for it. Usually, there is something that is causing that change, or the reason that they want that change. It can be anything that, from embarrassment, of a life event, someone called them fat, or whatever the case may be, and it's finding that emotional character, that emotional there's a word for it again, and I keep losing my mind. But pretty much you want to find that cause, and it's usually emotional, or it's an event that's happened. So, and that's what's going to cause change. Without that, you're never going to have that change.
100%. And I think Todd wants to build on that. It looked like he was about to jump in. Go for it. I know you're killing it.
I'm not the sharpest pencil in the cup or anything like that. So I like to break things down as simple as I can to help them make sense in my own mind. And as much as this pains me to say this, because I used to be a drill sergeant, people do not do things because they're told to do them. They do things because they want to. And there's got to be a why behind that want to. And simply spoken, what a coach does is help them find their why.
And Todd, I'm going to add on to yours just from like a personal note. I recently had a conversation about like a behavior, and the person said, I'm going to do what I want to do, when I want to do it, and how I want to do it. So, it just kind of leads into this where if they don't want to do something, or if they don't realize something might be an issue, no matter if you see it or not, they're not going to do it just because you want them to do it. They need to be motivated into making that change.
Every one of us in this room can spend 10 minutes with somebody, and I bet have a plan and be able to tell that person exactly what they got to do, and their life will be rainbows and unicorns.
Yes.
But none of that matters because it's got to be linked to the want and the why.
Todd, remind me to get with you after class and tell me how to make my life rainbows and unicorns, please.
I could tell you, but you wouldn't listen.
That's right. I wouldn't. You're right. Todd's exactly right. And you're all exactly right. You have to connect it to the why. Now, if I were to come into a gym and say, I need to lose 100 pounds, but I have a wedding that a close family friend is getting married, right? And I want to be there for them. I want to look great. I want to feel great. I want to be my best at this time. That gives me something to work with, right? That gives me a little bit of a target date and a target thing, but it's still not deep enough. Why do I want to feel good enough? Why do I want to look different? We got to keep digging into that why. And then when it comes down to it and I say, listen, one day I'd like to get married. I'd like to be healthy enough to have a day like that myself. That's when we get to that why, right? We start building off of what really drives somebody to achieve a goal. And that's ultimately what coaching is. Well, I got dogs going crazy behind me. Sorry. Somebody got a bone and they're not sharing. All right. Let's see. So there's a video here, and I'm going to hit play and hopefully it'll work.
I chose truck driving as a living. Being in the truck, you got a lot of freedom. You're out there, you're your own man, you know, and there's nobody standing over top of you telling you exactly what you got to do.
But when Hugh Williams' blood sugar spiked, he failed his work physical.
I think it was kind of a shock to him when they told him that he couldn't work.
Been driving a truck for 39 years. I don't know what else I would do. That's the lowest point of my life, I guess.
The drug abuse just got worse, you know. It was like a downward spiral. The more I missed out on life, the worse I felt about myself.
Michael Perry found himself out on the streets, homeless and jobless, all due to his addiction.
I was at that point of hopelessness. Do you really want to die? I'm like, no, I don't. But I don't know how to help myself. And I want to help myself.
By the time these veterans turned to the Fayetteville VA Medical Center, they had both hit bottom. Expecting business as usual, they were intrigued when asked to participate in a new type of patient-driven care called integrative health coaching.
Integrative health coaching model is about treating the whole person, mind, body, soul, and spirit.
It's not, I'm going to the doctor and the doctor's going to take my blood pressure medicine and he's going to tell me I need to lower my salt. It is engaging the patient in their own health care.
I've got to get my A1C down so I can go back to work.
Nurse practitioner Janice Rogers recognized that for Hugh, traditional doctor's visits were not getting the job done.
So you were feeling okay,
Yeah.
and you had kind of gotten away from testing your blood sugars. What other barriers had you been running into?
Sometimes I wouldn't take my pills. I mean, not every day, you know.
Integrative health coaching offered Jan an innovative and dynamic way to empower Hugh, putting him in the driver's seat when it came to his own health care decisions.
Did anything kind of jump out at you?
Yeah, about everything. I
Okay.
hadn't done anything right. It was a one-on-one, and we met every week for an hour.
What steps would you like to take to reach this goal?
Well, we get the exercise bike. I'll start riding it and lifting that 20-pound weight. She didn't tell me what to do. She asked me, what did I think I could do?
Just looking at the wheel, you being in the center of it, how all these areas of your life actually really impact your health, and you being not even being mindful of it.
The components of proactive health and well-being, commonly called the wheel, is divided into segments, each representing a portion of a person's life. The personal health inventory is built around the components of the wheel and allows the patient to get an accurate idea of where they currently are and then look at where they want to be in their lives.
So it looks like you focused on the area of surroundings here. Okay.
It is important to ask what's important to the veteran because it allows them to gauge their motivation and also prioritize which goals they are looking to work on first.
If I don't tell you what's wrong with me, you can't help me.
So the next area on our wheel of health has to do with food and drink. You rated yourself as a 5, and you put down, I just don't eat right.
That's right.
Okay? But you really want to move yourself up to a 10.
Yes. When you're filling this thing out, if you're telling a lie about it, how you really feel that you're doing, you're not helping yourself because this is all about you.
If you can sum up for me, what really matters to Mr. Perry in his life?
Focusing on my recovery from addiction.
Once the inventory is completed, coaches work closely with patients to analyze their answers and help the patient formulate a customized healthcare plan with both short and long-term goals.
Doing that inventory, it kind of gave me a perspective of where I wanted to go. You know, I knew that I wanted to regain my relationship with God. I knew that.
And he felt like that's what kept him connected to his community, his family, and who he was coming up.
Without this crucial support, Michael had been unable to stick with any treatment program. This new holistic approach uncovered a need that traditional medicine would never have found. Reconnecting to his spirituality gave Michael the ability to set ambitious goals and stick with them.
We worked on being Michael Perry, the business owner. You know, Michael Perry, the daddy. the uncle, and the son. We worked on that.
Hugh found his motivation somewhere else.
Miss Rogers asked me what was important to me. And I told her that working was the most important thing in my life.
He likes to be able to provide for his family, and that was a big motivator for him. He wanted to go back out on the road. So his health became personal.
As Hugh developed a new healthcare plan that revolved around diet and exercise, Jan was there to help.
We sent him to the dietary class.
We're gonna look at the nutrition label. I have the Cheerios here.
I used to never look at a label. And now the first thing I do when I pick up a can of something, I turn it over and look at the label, look at the sodium intake and the sugar. When I lost all that weight and everything, I really felt better. I mean, I was beginning to feel like I was a young man again,
He's back driving his truck. I don't know who was more excited, me or Mr. Williams. I expected some change, but I did not expect this huge change.
His sessions with Ms. Rogers has helped me to exercise and weight, eating right, and I've lost weight too by doing it.
If the VA centers are not using this coaching, they should be, because it really helps. It gives you confidence in yourself and everything else.
And, empowered by that confidence, Michael is no longer homeless and has been free of drugs and alcohol for over 9 months.
It's a miracle to watch someone transition from who they were before and who they are now. His business is up and operational.
Every time I see Marcia, I thank her. That's all I want was my life back. I did the work to get it, but she pointed me in the right direction. Yeah.
All right. So that's just a video, obviously, that the VA uses. But it brings to light this second distinguishing feature, right? We talked about the why, but the patients bring to the coach the information, recommendations for treatment from the providers, right? And then they get to talk to you about how are they going to integrate that into their life. So you saw that with the truck driver. Tell me a little bit about what you might have taken away from that video when thinking about this second piece of what a coach is.
Well, it's like with the addict, right? It's not just like, well, how are you going to fix your life? Well, I'm going to stop doing drugs. Well, you have to work on the other aspects of it, who he is as a father and a son and an uncle and the spiritual side of stuff to get him off the drugs. So he has to work on that in order to get off the drugs.
Yeah, 100%, right? So a doctor will look at you and say, okay, yeah, we just got to get you off the drugs.
You stop smoking crack.
That's right. Quit the crack. Then what? So you're exactly right. They are able to then work with somebody like a coach that can help them down that path, help them even know where to start, right? Help them to discover what their map is, their mission, aspiration, purpose. Well, don't play again. All right, there we go. So here's the roles pretty much laid out for you. What we're not going to do is be content experts, right? We are not going to know everything about everything. We do not have to have an MD to be a coach. We do not have to be a therapist to be a coach. Actually, you're usually a better coach when you're not those things because you don't slip into that role, right? A coach is also not here to diagnose or prescribe things. So even though you may know that, oh my gosh, they got some red flags for diabetes. I like to say it that way because that's how the little old man from the show, what's that show called? Where he was he was with the sheriff. Charlie, don't give me that look because I'll start going down Michael Jordan, Michael Jackson there. I don't know. I can't remember the show now. But anyway, he always said diabetes. I have to pull him up for you so you know I'm not crazy. Anyway, so we're not there to point that out and say, oh my gosh, you have diabetes and you're going to need to stop eating all those sweets. That's not for us to say. We should notice the red flags. we should maybe ask them some open-ended questions that helps them to lead to, something's not right. I don't feel good. Maybe I should get some testing done. But we'll figure all that out down the road. As a coach, you should know what those little pieces are, but you're not there to diagnose. Okay. So what we're going to do is we're going to have a working knowledge of evidence-based health information and recommendations. We should know these things. And I will say on the health and wellness coaching exam that the board puts together, they go by the CDC guidelines. So if you want to go ahead and jumpstart your studying, if you're planning to take that exam, CDC guidelines are where you want to get your biometric information. Even though it may be a little different than some of the other things that are out there, that's what they go by. You want to understand the basic health recommendations, what it is for health promotion, what it means to prevent diseases. What does that look like? You need to know that general information. Doesn't mean we're going to offer all that information just flat out, but we'll teach you how to use those different tidbits of information that you do have. You also, and we'll get into this later too, this is just to kind of give you an idea of a health coach. You also need to know how to refer them to somebody if they do need more help than what you can give them as a coach. So let's say, for instance, mental health. If they have certain things that are red flags and you know as a coach that's out of your scope, what do we do next? We need to have those kind of ideas ready to roll if it's ever needed. Okay? So that's what a coach is and is not. We're there to support. We are not there to diagnose. We are there to guide. We are not there to tell them what they need to do, right? So here are some accreditations that are out there. Right now, in this course, we are approved by the National Board of Health and Wellness Coaching. So that's that first one there. And we'll kind of send you to their webpage at different times throughout the course. We'll tell you to look different things up and get familiar with their website, because they have a lot of good information to help you prepare for that exam if you plan to take it. It also just helps you as a coach to understand a lot of the basics. We are also backed by the Holistic Nursing credentialing. That just means if you are a nurse or plan to be a nurse, you can utilize this course as well to help you gain the information needed to take that. There's another accrediting body. It's called the International Coaching Federation. You are welcome to explore it. We will kind of dive deeper towards the end of the course just to give you more insight into what that is. But to what we teach, we stick more with the National Board of Health and Wellness Coaching, and we kind of consider that more of the kind of gold standard of coaching. ICF is going to be more so, well, it sticks with the motivational interviewing at its core. It's not a whole lot of difference between that part. There's just little minor details that are different, but we'll dive into that another time. Okay, so if you were to go and look at the National Board's website, you'll see their commitment. We've circled it down there for you. Basically, they commit to deepening the learning across the organization and supporting continued development in the communities. They are there to support you in any way they can. They've got a lot of information out there where you can get more information, where you can dig deeper into studies, all that good stuff. So again, just be familiar with that website because it's going to help you in the long run. But with us being accredited through them, we are committed to that as well. So Charlie talked a lot about how we helped with, when we were at the VA, creating those self-sustaining plans out in the community, right? We teach people to go and teach Tai Chi or do Tai Chi classes in the community. We do that with yoga, that kind of stuff. Well, same thing with coaching. The board is telling us basically they want to keep putting more and more coaches out there to help the communities. And that's what really drives Charlie and I when it comes to this. It's basically keeping people out of that hospital. kind of like you said earlier. So these are the characteristics, whew, that's a big word, of a health coach. You're going to see this a lot. We're going to have this in a lot of our different slides. But at the end of the day, these are the things you want to stick close to as you become a coach, right? So your qualities of a coach are being respectful, present, mindful. You have a guiding style when it comes to coaching. You can articulate, which I struggle with apparently to this day. You're succinct, curious, empathetic, a partner, open, and it can go on and on and on. So in your mind, if you were looking at qualities of a coach and you were being coached, what are some qualities you would look for? What's going to make you comfortable? Absolutely nothing's going to make you comfortable.
I would say respectful. I mean, I would say all of them, but
Yeah.
Big one for me
Anything.
is respectful, being present, because I know a lot of coaches, they're just there, but you can tell they're not really like listening.
Yeah.
But I've had that experience with a lot of coaches when I was a manager, and being empathetic as well, because you hear so many stories so many times, you become very desensitized to some of the stories, and then you become less empathetic about it. So kind of putting yourself in their shoes and being empathetic of what they're going through and understanding what's going on and being that guidance is a big thing, which is the guiding style as well. So, but I mean, I would say all of them, obviously.
Yeah. Yeah, absolutely. They all kind of embody that coach that you'd be looking for sure. Respect, absolutely. Open-minded and really listening to you. It's 100%, right? You can tell when somebody's not listening to you. If I'm doing a virtual coaching session and I'm talking to you right now, but I'm doing this and I'm like, yeah. You're like, why am I wasting my time talking to this person, right? Like they're looking off somewhere else. They're not even paying attention and they have no idea what's going on. It's very easy to do that in person or virtually and make somebody feel a certain kind of way, even if you don't mean to. Snezna, what you got?
Oh, wow. Yeah, I think we've all had plenty of those meetings where you're sitting, to your point, with somebody and they're all over the place or they're in their phone and I just want to take the phone and do some awful stuff with it. But I agree with this whole entire list, but also what I think is important as far as, for me is being non-judgmental, because sometimes it's really difficult to open up to somebody because there is this fear of, oh, are they going to look at me differently, or are they going to judge me, or how can you help me if you're already judging me? So I think that's a really important one. And also having a sense of humor as well. I think that goes a long way just to kind of make a person feel a little bit at ease and relate to them in a little bit different way.
I agree with that. Absolutely. So two sides to that, right? Humor is a fantastic thing a lot of times, and it can make situations more comfortable. It can put somebody more at ease, especially if they know you're not expecting some kind of perfection when it comes to these sessions of coaching. But on the other hand, on the flip side, there can always be too much of something, right? So if there's somebody where you can tell their personality is not so joking, not so humorous, they're really there for business, we got to pay attention to that too, right? And it's almost like mirroring
your
a
audience.
person. Yep, know your audience, mirror their energy, right? So if they're coming to you in a very serious way, it's okay to lighten the mood a little bit, but don't do the whole time and make them honestly uncomfortable by you trying to lighten their mood, right? That's not our responsibility to lighten their mood. So there's an equal balance to just about everything. But to your point, you speak to your audience. You kind of take into consideration all the different dynamics. Okay. So now we're going to look at that second column. It is coaching skills. So these are the skills that you're going to learn a lot about in this course. So asking open-ended questions, allowing self-discovery, meeting the client where they are. Holy poopsicles right there. Meeting them where they are. That is the bread and butter to coaching. We are not telling them where they need to go. We're not telling them where they need to start. They're telling us and we are just meeting them there, right? Active listening, developing and revisiting visions. We'll talk about more of that. Using tactful skills to interrupt and redirect. Oh my goodness, this is one of the most uncomfortable things for a lot of people. If I were to tell you about a lot of my clients when I was at the VA, well, they were patients. I didn't really call them clients, called them patients, but a lot of them just needed somebody to talk to. Sometimes they were just lonely and they needed to talk. But I had a very limited amount of time of how much time I could sit and talk to them because I had a full day of patients. So when is it appropriate to interrupt and redirect, but how do I do it in a respectful way as well? So we'll talk more about that in the coaching course. And then reflections, we'll talk about those a lot, but it's basically taking their words and reflecting it back to them. People can say some pretty amazing things and not even realize it or not even truly understand what they just said until somebody reflects it back to them. And then they're like, holy moly, that's big. And those are my words. So we'll talk about the power of that. What are you laughing at over there, Killa?
No, I was going to say, or they'll tell you, I didn't say that.
Or they'll say that, but if you're reflecting right after them, there's really no way for them to deny it. But yes.
No, that is one of the powers of the reflection though, because I have verbatim reflected back to somebody. That's not what I said. I go, well, then what did you say? You got that. It allows for clarification.
Mm-hmm.
And that's one of what makes it very useful.
Yeah, it absolutely allows for that clarification. It helps you to understand what it really is that they're trying to tell you. And then there's coaching strategies. Again, we'll talk more about this. This is just to introduce you to it, but you're going to help facilitate vision. What do they visualize as being the end result or where they're wanting to go with things? Explore their values. What is it that they value that you can connect to this and create maybe an approach where they're continuously motivated by those values, right? Establishing an area of focus. I may tell you I want to lose 100 pounds, but that's not something I just go and do. There's going to be little small steps that get me there, little behavioral changes that are going to add up to that in the end. Facilitating a long-term behavioral goal, guiding clients towards the action steps and leading them to that long-term sustainment and behavioral goals. Utilizing the technique of SMART. You guys ever heard of a SMART goal and how to break that down? Todd hasn't. We're going to educate him a little later, but those come in very important.
Sorry, I saw it like early on when we were looking at it. I was like, I don't want to get ahead of things, but I just had like 18,000 flashbacks to social work classes with SMART goals, and it was like ingrained in us. And then I was like, oh my gosh, did I forget what SMART goals stands for? So I was over here like, pay attention, trying to like run through it. Anyways, continue. Yes.
You're good. And even if you forgot it, we're going to go into it pretty deeply in some of the courses ahead of us. So not to worry, we'll give you a good review of them.
Don't tell any of my former professors that I briefly forgot it. They would be devastated.
Devastated. No, you're good. We'll get you reminded and then just pretend like you never forgot it in the first place, right? It'll be fine.
I totally didn't. That's crazy.
And then the last thing we're going to do is explore perspectives. We'll talk about perspectives of others. Obviously, we all have our own perspective, depending on the situations we've been through in life, how we're doing currently. There's going to be all kinds of different things that take effect in that. Okay, so when we talk about being a coach, you see these little bubbles on the side. These tell us what we are. We are change agents, collaborators, and we are partners. We focus, if you look on that right side on the bubbles, we focus on a strength-based approach. We talk about our strengths, not our weaknesses. We remind them of their strengths and what maybe worked in the past and what could work today. We talk about present and future goals. We don't necessarily focus on the past if there's something that didn't work out. You know, we don't have to let that hold us back. And then it's whole person centered. We will tell you this over and over and over and over again, and you'll see in all those different examples that we show throughout the class. But there's always going to be that person centered approach. It's always about them. If you learn anything in this class, walk away with knowing that coaching is all about the person you're coaching. It has nothing to do with you as the coach. So we are here to inspire, motivate, and empower. That's our biggest 3 things we're looking for. All right, so here's some differentiatory things between what a coach is, what they're not, and depending on kind of your background, you may have some insight into therapists and mentors, consultants, and then we're going to tell you a little bit about what coaching is. So a therapist deals mostly with a person's past, their trauma, and helps them to seek healing. That is not a coach. We're not there to therapize. I know that's not a word, but somebody used it yesterday and it's like my new favorite. Mentoring deals mostly with succession training and seeks to help someone do what they do. So you're going to notice that we will mentor you throughout the course, but what you're not doing with your client is mentoring them. You're coaching them. There's a difference. Consulting deals mostly with problems and seeks to provide information, expertise, strategy, structure, that kind of stuff. You're not their consultant. You're not there to fix it. So as a coach, you're dealing mostly with the person's present and seeks to guide him or her into more desirable future altogether. And they tell you the specifics of that future. They tell you the specifics of that goal. So I'm not going to sit here and read through all of these and challenge your reading abilities. I'm sure you see some of those differences. Does any of this stand out to you? Does anything on this page stand out to you that you have a question about or that you have a comment about? Therapies.
I think the hardest thing, like for me personally, would be to not tell them like, well, just go do this, right? Just, why don't you just do this, right? Instead of slowing it back and, you know, letting them come to that determination.
Yeah, it's a hard skill. It's something we have to learn and practice. It's hard not to tell people what to do. Todd struggles. He tries to tell people what to do all the time. He was a drill sergeant. He knows how to tell people what to do and expects it to be done. That as a coach, he can't do that, right? As a coach, I can't tell you, well, get off the couch, stop eating potato chips and go work out twice, this week or 3 times this week. Get started. Stop making excuses. That's not a good approach. They probably won't come back. Mark, I saw you unmute. What you got?
Yeah, I was just gonna say I like where it says co-creative equal partnership, and which makes the coach helps the client discover their own answers. I don't know. I just thought that was really cool.
Yeah, absolutely. The co-creative part, it actually does get fun as a coach. Just because you're a coach doesn't, well, I don't want to confuse you guys too much, but just because you're a coach doesn't mean you can't help them to get creative. You can. There's different approaches to it and different ways of keeping them in control of the conversation while you're doing it. But we do have the ability to be creative with them and have fun with them. Anything else stand out on there?
I guess under the therapy category, where it says assumes emotions are a symptom of something wrong, that stood out to me, I guess, just because in my experience, I haven't really experienced that. Coming from like a therapy perspective or someone who's been in therapy, in my experience, I've definitely had more of like what is in the coaching category, and that's kind of what like my training was in. So that part seems like it feels natural to me, I guess, but I don't know as much if I like fully, I guess, agree with what is just like blanket in there, but I know it's like a lot more complicated. There's a lot of different types of therapy and therapists and stuff like that. But I don't know, stood out to me because I'm like, that makes the most sense just in a general.
Yeah. No, I
Is
think
to assume that they're normal.
yeah.
Emotions are normal.
To be honest with you, I agree with you 100%. To assume emotions are a symptom of something wrong for a therapist, if you blanket that comment across the board, that's probably not accurate, right? And I don't have that experience either in therapy. But what I will say, in our culture, in the Western culture, when do we tend to go get help from a therapist or a mental health provider? When is it we decide we need it?
That's a good point. Yeah, when something is quote unquote wrong.
Court ordered.
Court ordered. Yeah.
That too. Lots of
We
different
know.
well, something's wrong there too, though. So
Right. But in the Western world, we have this stigma around mental health. And I'm glad you pointed out, because it is a stigma. We think that you need mental health providers when something is wrong, when you need to fix something, right? Instead of, like we think with coaches right now, and we should be thinking about mental health providers like this as well, to assume that all the emotions are natural, all the different stages in life are natural, and it's okay to even prepare for things when it becomes hard, right?
yeah, I guess in my opinion, and just with my own experiences in life, it's I hate the stigma that's around any of it, just because I don't know, worst case scenario, who doesn't love complaining for an hour long?
Right.
You
Right.
know, just get it out of you. So, something might not always have to be wrong, but like the idea that it's just nice to have someone to talk to, like that's a third party perspective, I guess. So, I don't know, that just stood out to me on the therapy side, but that makes a lot of sense to like we do go when something is wrong. So,
Yeah.
And I'll add, a therapist has to have a diagnosis, right? So they have to assume that those emotions are causing that turmoil, because that's the part that is related to the billable thing that they have to come up with, right? To go see a therapist, you have to have a diagnosis in that first visit to be able to be billed through insurance, right? How well do you know somebody? And you have to do that through an algorithmic way that is laid out already ahead of time. And then you can only see that patient unless they're paying on their own. You can only see them X amount of time that is laid out by their insurance company and what is allowed. So, I guess really, whenever you think about mental health in this aspect too, when we start talking about assuming emotions and therapy types of things, is we're also talking about this in a managed care organization. We're not talking about people paying for this outside of their own and being able to do that. But really, if you go see a therapist, for the most part, you should be seeing a therapist, and they should be working with you in evidence-based protocols that, move you along in your trauma treatment, whatever you're getting, depression, and then that therapy should end at some point. They get you back to that neutral place, kind of going back to that illness wellness continuum. Whereas health coaches, again, take that a step further, and they don't use that judgment. They don't use, from the very beginning, they don't use any of that piece as a judgment to be able to get a diagnosis, because their CPT codes don't need a diagnosis to be able to move forward either, right? So then there's that piece that is kind of different from the traditional model of therapy with the coaching model that is coming out as well. So I just kind of wanted to add that piece in there.
Always comes back to the money. That's how you know you truly understand healthcare. All right. Good insight. Okay, so we'll talk more about this as well. Again, just kind of a teaser to show you a little bit, but the coaching process has a model that we separate into 4 stages, okay? Stage 1, we're talking about that map, the mission, aspiration, and purpose, and we're exploring that with the client. This helps us in stage 1 to create that vision of whatever the goal is for them. What is it that they're visioning? We get to explore the values in their life, but we also get to explore value conflicts. And just to make that a very simple and easy kind of understandable thing is, you could say something as simple as, and I say this because it's one we used a lot at the VA, I really want to lose weight, but I also really love donuts. Well, heck, that's a value. I really want to be healthy and lose weight, but my conflict is donuts, right? So you'll have a better skill set on how to explore those. Then, once you kind of have that foundation laid, we jump into stage 2, and this is where we reflect, assess, and we focus in on an area they want to look at. So this is where they talk about a PHI, the personal health inventory, on that video. It can be a whole health inventory. You can call it a lot of different things, but it's basically some questions that gives us an idea, some open-ended questions or some scaling questions that gives us an idea of where they are and where they want to go, where they are right now, meeting our client where they are, and then understanding what their goals are and why their goals are there, the why behind it. We define the focus, assess the readiness to see if they're ready to start making those changes. And we have different skill sets on how to jump into that as well. Okay, then we go into stage 3, and this is where we plan for the action. This is where we've got it all figured out. We understand what they want to see. And now we start creating those goals and those action steps. That's where that SMART comes into play, Kirby, and we'll get into it, but that's where those SMART goals come in. We're going to explore some barriers. So, hey, I want to start running, but I don't own running shoes. That's a barrier, right? But we don't know that until we have that conversation with somebody. We talk about training and support and accountability. This is where we ask them, who's going to hold you accountable? How are you going to know you're successful? Who do you have to help support you? That kind of stuff. And then in stage 4, we're going to execute the action. This is where we then take it one step further. We start to plan, replan if we need to. If we see barriers got in the way and we need to refocus on something, this is where we can do it. We check in on the status of where they are in those action steps or those goals. We learn lessons. If things didn't go quite right, we talk about it. What happened? What are things we need to change? What are things we need to think about? And then we can either replan and take more actions around it, or if they're being successful in what they're doing, you can move forward in that. Okay. Again, lots of skills, lots of different things we're going to use in all those stages. But right now it is just simply to give you an idea of coaching. Okay, so the board has different competencies that this course, as well as any other course that's accredited, has to hit on. And these are the competencies that you're going to see throughout the course. So there's a coaching structure, which we went through those stages right then. That's kind of how we start structuring things. We have a coaching preparation prior to the session. We'll talk about different paperwork that you'll want to have. We'll talk about different things you want to think through before you start coaching. Lots of different avenues, and we'll explore all of those. We'll talk about the first session, the initial sessions, the ongoing sessions, the final session. We'll talk about all of that stuff. We'll talk about the coaching process and mindset. So the coaching relationship, it's a lot like anything that you've probably done in your career. There are lines of being ethical, right? And what is a coaching relationship and what should it not be? Where is that line drawn? Communication, how best to communicate with people, as well as utilizing the techniques and skills that we'll talk about. Health and wellness, basically we're talking about those biometrics that we hit on earlier, about the CDC stuff. There are things you want to know about chronic diseases. There are things you want to know about red flags that you may want to watch for, and that kind of stuff. We'll talk about that. And then we'll talk about the ethical and legal parts of coaching. holy poop, there are some legal things you need to know. Because with anything, there is always, I don't know why I keep referring to poop today, but there's always professional conduct that you gotta maintain no matter what. All right, any questions about the competencies and what you're gonna learn? Cool. This is the easiest day because I'm not actually teaching you this stuff. I'm teaching you what we're gonna teach you, so I don't really have to know much. That's pretty easy. All right. So there's your model, the process model. We just went over that. I think I just went backwards. All right. Any questions, comments, concerns about what this course will cover? So with all that said, what's a health and wellness coach? Go.
Somebody that helps a person establish their values and set a goal and help hold them accountable to the goal.
Love it. What is a coach? Not. That's totally not grammatically correct, but
A therapist.
Yep.
a therapist. Yeah.
It's not a
Doctor?
prescriber, a diagnoser.
Yeah.
Not a doctor, not a prescriber, diagnoser. Absolutely. So moving forward, does everybody feel comfortable with the roles of what a coach will consist of? You feel good about it?
Yeah.
Awesome. All right. So I'm gonna turn it over to, I believe, Todd now. I guess I have to quit. Did I quit sharing? Yeah, I did.
Oh, me. And Haley just said she gets to take it easy because she's just going to tell you what they're going to teach you. Well, I actually see how they dump on me. I actually get the first module that I get to teach you. I'm going to introduce you to one of the first theories that we're going to talk about throughout this. And technology's not my friend, but I think I just did it. We're going to go ahead. Oh, let me go ahead and grab this from over here. Put it where I can see it. What we're going to do is we're going to talk about the trans-theoretical model of change. It's been around for, well, less time than I've been around. So it's been around since '83. Pacheco and DeClempty developed it way back then, but it's an integrative biopsychosocial model to conceptualize the process of intentional behavioral change. And that just tells you what they did. They did a little test, interviewed 1,500 people, weight loss, smoking cessation, that people make sustainable changes on their own timeline and according to their values and their social support. People do what they want to do, not what we tell them to do. And it's really synergistic, and that modifying behavior alone is not effective long-term. And if you look at that, the big thing, that draws my mind is, anybody watch an hour of TV, you're going to see a commercial for a weight loss program. These weight loss programs, they put you in, they have great success. People lose a lot of weight over a limited amount of time, 98% success rate. But then 6 months to 90 days after they get out of the program, they're right back to where they were, or even put on a few extra pounds. They modified the behavior in that limited time frame, and it wasn't sustainable, and it wasn't effective long-term. And here we're going to talk about those stages of change, and there's 6 of them. And you got the pre-contemplation, contemplation, preparation, action, maintenance, recycle, and relapse. And I'm going to just say that, you got to understand that we talked a lot about life and everything as we've been talking. People can be in different stages of change in different aspects of their life. They may be ready, to make a change in one area, but they're totally in pre-contemplation in another area. And the other thing that I'm going to say before we get into these definition is, this is really for you as health coaches. I want you to look at this theory as a theory that allows you to meet the client where they're at. It's to inform you, your understanding, because when you look at the definition of pre-contemplation, someone that doesn't intend to make a change in 6 months, a lot of people may, oh, that person's not ready for coaching. Come back when you're in contemplation or you're in preparation. But really, it's for us to meet them where they're at and understand that maybe we got to do a little more exploration with them, that in pre-contemplation, a little more vision and values exploration to help them find their why. But pre-contemplation, can I get someone to read that real quick?
Yeah, a person in pre-contemplation is not ready to change and does not intend to change in the next 6 months.
And again, that person, still ready to be coached. It's just, we got to spend that time creating that vision, painting that pictures. You don't know what's going to be the impetus to change. And, I think somebody earlier and there's talked about change being emotion driven, and a lot of times it is, but we got to really explore that with somebody. And then we have contemplation. A person in contemplation, they got a little ambivalence going on. They can see, yeah, I should quit smoking, and I also, it helps me alleviate stress. It gives me 6 extra breaks at work that my coworkers don't get. They got a little ambivalence. They can see reasons on both sides of the coin. But it's really that first stage when someone's in contemplation, when they're really starting to be able to see the possibility and some reasoning for change. Someone want to read preparation for me?
A person in preparation has made the decision to implement change and is beginning to prepare for change within the next month.
Yeah, that's that person. Maybe they're doing some research. Maybe their mind's made up. They're starting to look at gyms that are underway on their route to work, or, they're thinking about, maybe changing their grocery list or changing their buying habits at the grocery store. That's that preparation stage. That's where we're at. Then we got action. That person in the action stage, they've started doing something within the past month, and they're working on really developing a plan and to sustain the change. They put things, it's right there, and they've implemented. They're moving towards, they're working at, they're taking those steps. Look at it as someone that started down that journey. They planned their trip and they've taken that first step down that path, down that journey. And then somebody that's in that maintenance, that person, they've been doing it, the behavior change, it's been ongoing. They've been able to maintain it for 6 months or better, and they're doing pretty well with it. Someone want to read that one for me?
Sure. Once a behavior has been maintained for more than 6 months, the coach helps the person determine between termination and continued maintenance.
Yeah, and that's really where they're at. We can move into another area. They can start working in another area. And the other thing that we got to understand too, is this is a cyclic process, and people can relapse. They can fall back into the old behaviors, and because, and I like saying it like this, back in the early 90s, Mike Tyson says everybody has a plan till they get punched in the face. Well, as coaches, we help people develop plans, and life will punch them in the face. So there can be relapses and some things that where maybe we got to go back into the preparation stage. We got to get back at it. We got to go back into the action stage with them. But that's really where we're at with these stages of change. You got the pre-contemplation, contemplation. preparation, action, maintenance, and then you got this relapse or recycle. And also understanding that people can be in different stages in different areas. So as you guys are just started your path, evidently you're already in the action stage of your steps towards becoming health and wellness coach. Why do you think it's important to understand these stages of change as health and wellness coaches?
You're going to get a better understanding of where that individual is at and how to help support them.
Meet them where they're at. You know, we can meet them where they're at with that beginner's mind, with acceptance, honoring their autonomy, encourage growth and learning. And I think someone said it, that non-judgmental approach that we have. And, you know, when I think of beginner's mind, again, you know, you guys will get to know me, but I try to make things simple. I just call it toddler brain. That 2-3-year-old, everything's new and exciting to them. You know, just meeting someone where they're at, you know, with that acceptance piece and honoring who they are. Then it also allows us, these stages of change, we can explore for some more deeper understanding. Look at their interests. What motivates them? What's their readiness to explore? Really, what's important to them? You know, look at what they want their health for. And just our understanding of these changes has changed. It really helps us to meet them where they're at and then set up that path of exploration with them. I'm going to stop sharing and I'm going to put it out to the group. I just gave you, like, I don't know, was it 10 minutes even on the stages of change? High level overview, because we're going to take bigger steps into it as we go on. I'm tripping over my tongue today. I feel like Charlie, but so does anybody have any question around the stages of change? How it really relates to health coaching? No, hearing no questions. This is what I'd like to do. And since I'm not the boss here, Haley and Charlie are, I'm going to go ahead and throw something out there. And what we got coming up yet is we're going to do a coaching demo. I'm going to coach somebody for a little bit. I'd like a volunteer from among you, everybody here, to be coached by me in front of all our peers. So I appreciate the volunteer. So if you want to volunteer, just throw your name into the chat and I'll pick the first person that volunteers. But if Haley and Charlie are okay, we can take a 10-minute break, because I can't coach on a full bladder. So if you want to be coached when we come back, just have your name in the chat. I'm going to go utilize the facilities here. But 10 minutes. So that's 5 after the top of the hour. Well, just to set this up a little bit, again, you know, Charlie already said we're going to do stage 1. And I also invite you, you know, if there's something that happens in there and you have any questions, you know, like, why did you do this at this point or anything like that, go ahead and jot those down too. And the other thing, and I'm going to go ahead, and if I remember how to do this on Zoom, you didn't give me the ability to spotlight. You didn't make me a producer, Haley. There, now how about spotlighting Austin with me?
I felt like that was the most judgmental I've ever heard.
You're awfully demanding today. All right, got it.
All right, and for everybody else, you're welcome to keep your cameras on or turn your cameras off. Me and Austin will be in our own little world down here. But All right. I just want to start off, Austin, by, I appreciate you volunteering for this coaching session. And before we get into it, one of the things with coaching, is we often start with what we call a mindful moment or a little bit grounding or centering exercise. And I can take you through one if you care to do a little grounding with me, or.
Sure.
So what I'm going to offer you up then is just a little exercise. It comes from HeartMath, and it's called a quick coherence technique. And, the cool thing about this is it's a technique that, I like to say you can do it before the bear starts chasing you. You can do it while the bear's chasing you. You can do it when you're up in the tree and after the bear's gone away and you're safe to come down. But it's just a little bit of, by coherence, we mean just that centering piece that allows us to bring it in. And to do this, what I'm just going to do is I'm just going to invite you to breathe a little deeper than you normally breathe. Maybe inhale for a count of 5. Exhale for a count of 5. Or whatever rhythm you find comfortable.
Okay.
And as you're inhaling, just picture that breath flowing into the chest, into the heart. Slower and deeper than normal. Seeing the breath flow into the chest, into the heart. And as you're continuing this heart-focused breathing, I just ask you to grab hold of a regenerative feeling. It can be a feeling of compassion, love. It can be a feeling of accomplishment. It can be for a special place, for a pet. And I just invite you to hold on to that feeling as you see your breath flowing into your chest, into your heart. Breathing slower and deeper than normal. Holding on to that regenerative feeling. Just go ahead, continue this heart-focused breathing, holding the regenerative feeling, and then whenever you're ready, by sight or sound, let me know you're back with me.
Okay.
Okay.
We're back.
So Austin, with that quick coherence technique, what was that experience like for you?
It was relaxing. But it also kind of helped me notice like how I guess kind of all over the place my head is. Like it reminded me a lot of like meditation, right? And you kind of like pull yourself out and pull yourself back in. Right. And so it was nice. It's nice to just take a second.
So kind of dual purpose. You got a little relaxation out of it, but a little self-reflection. I'm here and I'm there all at the same time. Yeah.
Yep.
Yeah. And, we're going to go ahead and get into this, but before we get started, I'm going to ask you a 2-part question. What do you know about health coaching, and what brought you to health coaching already? Start with the first part. What do you know about health coaching?
Well, aside from what, we learned today, not a lot. I didn't even really know. Well, I didn't know that it was a thing up until 2 weeks ago, 3 weeks ago. It's like I had no clue what it was. And so I guess as far as, what I know about it, it's very surface level, but I think I'm starting to get a grasp of it. I've done a lot of research over the last couple weeks. And I mean, it's pretty much all in line with, well, it is all in line with what you guys have talked about today.
So you had a limited knowledge, but you sought to fill that in the last couple of weeks before you started the course. You learned some things, and then this morning reinforced it for you.
Correct.
Yeah. And, I'm going to change my second question up with you and just ask you for like an end state, a goal. If you leave this session feeling good about this session, what do you want to take away from it?
The session between you and
Me and you right here.
Yeah. I guess the structure, and not only the structure, but the tools and the tactics that you use to help me guide myself through it, I guess.
You're after to see a good role model of what coaching looks like to further your learning a little bit. Yeah.
Right. Because I've never been through a session. I've never, I guess I've watched some sessions like on YouTube or whatever, just, doing my research before getting into the class. And, but I just don't know how it goes, I guess. So just understanding that is probably the biggest thing that I want to take out of this.
Just, you've already mentioned research a couple times. Is that something that, you like to be prepared for things? You do research often?
Yeah. I'm that guy that, if I want something, like if I want to buy something, I dig and dig and dig, and I find all the good, I find all the bad. I guess I would focus more on, I'm like the guy that goes to the reviews and then I go to the 1-star review, right? Because I want to see what the bad part about it is. But yeah, I like to be prepared and kind of have an insight on things before I do it. Or like I said, if I'm going to go buy something, I'm not the kind of guy, if I want it now, and I'll do anything that I can to talk myself out of it. And if I can't find the reason to talk myself out of it, then I'm just going to do it.
So you gather information, yet you make your own decisions in the end.
Correct.
Yeah. So we're going to switch it up just a little here. And, if I asked you just a high level question, Austin, what do you want your health for?
Longevity, and so that I can provide for my family.
Being around for your family.
Mm-hmm.
Yeah. And, family can mean different things to different people. What's family for you?
So it's my main core, my wife, and we're working on having a baby. So eventually, my kids, and I've got 2 dogs that I don't know, you probably can't see it because it's blurred, but they're all over the place all the time. But and my parents, and then I have a core group of friends and a lot of acquaintances. So, the ones that are just people that are close to me. It doesn't necessarily have to be blood.
Yeah. Dogs are people too.
They are, though. They're the best people.
And your family is really defined by that people that are close to you, people that you count on and can count on you.
Yep.
Yeah. So, and that longevity piece, being around for that future family, that's that baby that you don't have yet, that you're working on, is important to you.
Yep.
When we look at things and, jumping back a little bit in time, and if I asked you, when you were younger, what were your dreams and aspirations? Not like really like, what do you want to be when you grow up, but, just a younger self. What were your dreams and aspirations?
I guess to be successful, but then as I've gone down my path of trying to become successful, I've learned that success, for a long time I thought it was just money, right? And then I learned from a mentor of mine, what the definition of being wealthy is, right? And it was always in my concept of that wealthy is that you're rich. And it has, while it does have to do with money, it's just like with what we were talking about earlier today, it's everything else. It's are you wealthy spiritually? Are you wealthy mentally? Are you wealthy with your family? Are you wealthy with your friends? Are you wealthy, with all the different aspects of your life? So, I guess I learned as I went along it that, success is not determined by anyone else except for myself. Right? Like I'm the only person that can determine if I'm successful.
A younger Austin, success was equated to money and you had an aspiration for success. You've kind of changed that definition over time. And, when we go back to, what you talked about, what's important to you, that longevity piece, and then that family, the wife, the parents, those close friends, that helps define success for you now, Austin?
Yeah.
Yeah.
Yeah. I guess I've learned kind of recently, I guess, within the last few months that the power and the importance of putting myself first. Because if I can't provide my best self, then I'm just shortcoming everybody else.
Yeah. There's, and I know you were in the Marines, and there's a thing in the service about selfless service. And oftentimes that's equated to the concept of just you give and you give and you give. But it sounds to me like you realize sometimes to be truly selfless, you have to be a little selfish.
Yeah.
You got to take care of yourself.
100%.
Yeah. And, just what's taking care of Austin look like for you?
I guess taking care of Austin would be, maybe I don't sacrifice like my time or my family's time for work, right? And instead of making the sacrifice of like, oh, I can't go to the 4th of July party because I have to work, instead of doing that, making it a priority to take time off to go do that, and not feel guilty, I guess, about giving back to myself instead of giving to others.
You redefine success. Yeah. So if we, with your new definition of success for yourself, if you make no changes in your life, it's 0 right now, what's your life look like in 3 to 5 years?
If I make no changes,
oh,
miserable.
Can you paint me a picture of that misery?
I just think that I guess it's kind of unique because I'm doing this to like essentially try to quit my job and change my career path and like change how my outlook of things. So I can't say like miserable might be a little of a hard statement, I guess. I don't hate my life. I don't, I love everything in my life, but I just don't love where I'm at in my life, I guess. So if I change nothing, then I can only imagine that it would get worse.
And you're in this course, you're making active changes because you don't like the possibility of no change. So flip that on its head, throw that out. 3 to 5 years from now, you're living your fullest, richest life. What's that look like?
I mean, it looks amazing, but I guess my question in 3 to 5 years is, because it seems like that I have kind of a what's the word I'm looking for? Like a pattern. It's like every about 3 to 5 years, I'm like looking to do something different. And I don't know if it's because I get bored or I get frustrated or I get, probably bored is the best way to go about it. It's not a challenge anymore. So in 3 to 5 years, if I'm living my richest life, to me that would mean that I am continuing to grow and wonder, but I'm content with where I am at the same time. Content with the journey, I guess.
You're on that journey, but you're going to constantly be challenging yourself to grow.
Correct.
Yeah. So, we got like 4 minutes left here, Austin, before we get ready to wrap up and everything. And, your journey's never ending. You've defined that. You seek those challenges. You're always seeking to grow. What's the next step on the journey for you?
I think the next step on the journey for me right now is to put myself in an uncomfortable situation, meaning like, this is way out of my wheelhouse. This is so far from anything that I've ever done, and just watching it grow, I guess, and watching myself grow with it.
Put yourself in an uncomfortable situation. Your name's in the chat, Austin. You're doing it.
Mm-hmm.
Yeah. So, as we wrap up, Austin, what's your big takeaway from our 18-minute conversation?
Well, first of all, that 18 minutes flew by. It didn't seem like it was 18 minutes at all. But what I guess what I've noticed out of it is that you did a very good job of asking me a question and letting me answer the question, and then reflecting back on what I had said. And so like clarifying with me, and just making it about me. It was all about me. I don't, you didn't talk about yourself at all.
It's all about you. And this journey is all about you, Austin.
Right.
Thank you.
Yeah. Thank you.
All right. So let me start unpinning people, and then or we can just leave Austin up. We'll just all stay with him. There we go. All right. So I want to open it up to the group. After kind of seeing that stage one, remember there was different stages. Stage one, we wanted to understand mission, aspiration, purpose, truly kind of lay that foundational work for coaching. As you watch that between Todd and Austin, what are some things you picked up on? Maybe some things on that list that we showed before that you picked up on in that session.
So, I think before we get going, I wanted to say thank you to Austin for putting himself out there. That was a really brave thing to do in front of us. So thank you for being willing to do that.
Yeah. Thank you guys. I appreciate it. Do I get like a cookie or something?
Sure, I can send you some.
Yeah, Charlie actually gives out ice cream to people, so he'll be over at your house handing out ice cream soon.
Nice. Good thing I'm not trying to lose weight, huh?
No, I thought it was really cool because, like, even just at the beginning with the grounding exercise, like Todd already gave Austin up, like he got to choose what that grounding was going to look like, what that breathing is comfortable for him, because it's such a difference between like that therapist role where they're like, okay, this is what we're going to do, and then Todd gave Austin that space to make a choice of what he wanted it to look like. Another thing was like just the open-ended questions were great, and how like there was a reflection on every single response given. And it just seemed like I know I wasn't in the same position as Austin, but it did feel validating at the same time, like you were really like Austin was being heard, And then to my last thing here was one of the statements that really stood out to me that Todd had was paint me a picture of that misery, like really given the floor to expand and even just create a visual for Austin and for you, Todd. So like those were the big things that I took away, and I thought that was really cool. It's really cool.
I agree. I was writing those down. I agree. I think it's really nice that you noticed all the reflections afterwards. So when you're coaching, we have a mentor named Brian McSpadden. Charlie said he called him Colonel, which made me think of him like on a cereal box. But that's a whole nother story. Anyway, Colonel. Reflect, reflect, reflect is all that he talks about, right? And a good coach, a coach that is really tapping in and validating somebody, is continuously going to reflect back. And if you notice, when Austin heard those reflections, he would build on that information sometimes, right? He would continue to elaborate and kind of talk more about what it meant to him or why it was important to him. So without Todd even having to ask more questions, just the reflection kept that conversation alive and going. Nice. Great work. Anybody else have things they noticed in that?
Well, I'll throw something else out there. Like at first it was a little weird when you just repeat back what I say, right? But at the same time, I think it's weird because no one does that. And I think that is very powerful for a lot of people. And a lot of people will gain value from that, because I think that there is a lot of people that don't feel like that anyone's listening. It's like, just like, we talk to a doctor or whatever, and you tell them what's wrong and what you want to do, and they're like, yeah, you're not going to do that, you're going to do this. Right? And you leave or whatever, and you go, well, why did I even go? Like, I think a lot of people can figure out their own problems on their own if someone would just let them say it.
Talk it out, right?
And
So
I'll say,
go ahead, Todd.
I was just going to say, it's almost like a different communication style. And when we talk about coaching and what the reflections are, and what I like to liken it to is, as a coach, what you're doing is you're holding up a mirror. And I think in the coaching session, the coach has the easier end of it, because it's the client that's got to look in that mirror. And, we're holding that space. The other thing that you may notice in coaching, and that we'll talk about too, is the power of the pause. We'll talk about that later, but Austin would say something. I put a pause before my reflection. And most people were conditioned from society to fill that immediately with words. But because we're listening to either how does that relate to my past experiences, or how am I going to fix this person, or how am I going to answer this person? And that's where our brain's going. But what the pause actually tells somebody is, what you said is important. I'm digesting before I respond. And that's a critical skill for a coach to have.
Well, I think a lot of people, I'm sorry, Craig, I don't want to cut you off, but
No, you're fine.
a lot of people, or at least what I feel, is that when you're talking to someone, they're just thinking about what they're going to say back. Right? Like, they're just thinking of a response. They're not actually listening to you.
Listening to respond versus listening to understand, right? Two very different things.
I was just gonna make a comment about someone had said people can often like figure things out for themselves if they just kind of like keep talking, essentially. And in my brain, I've always kind of internalized that as like the power of rambling, which is something that I do to my poor cats all the time. Because just like the act of verbalizing things, literally saying words out loud that like you're maybe thinking, ruminating on, I feel like for so many people, that is like how you just feel like, oh my God, of course. Like, it's almost like hearing somebody else say it. And I thought that throughout that whole, session, it was like that we were listening to, it was like really, really well done of allowing the ramble to do the rambling, and allowing, the vulnerability to even get there. So, yeah.
Yeah. Awesome. Yeah, I totally agree. And I'm glad you brought up that vulnerability, because as a coach, we have to create that setting, right? Where somebody feels like they can be themselves. They can tell you the honest truth about what it is that they want, and what's driving them to get there. Austin could easily identify, yeah, he's got to start taking care of himself to be able to take care of other people. But when Todd reflected that back and said, asked a question after that and said, hey, what does that even look like? Austin had to think about it. He had to then become a little bit vulnerable, and to feel comfortable enough to do that and to explain that to somebody else. It takes that pause. It takes that coach being there to support them and truly listen.
And
Jump in, Todd.
genuine interest, I think, too, that was expressed when he was saying, what does that look like? That's not just coming from like a question just to ask to further the conversation. Like that's like you want to know, and I feel like that people really pick up on that, and like they will, match that energy and be like, wow, I feel like safer here.
But one of the things that I don't remember everything I did because I was really in the moment, but I do remember at that moment when I did the selfless versus selfish, and then the piece on, what does self-care look for that? And my reflection back to his self-care piece was that fits your new definition of success, which, his redefining of success was a big value of his, and validating and affirming that, and that he's living it, is that strength-based perspective coming into play in coaching again.
I think the one big takeaway I got from it too was that pause, and then that reflection gives the person also a time to think about what they said, because we're busy talking, we're making those statements, but do we ever really listen to ourselves and, well, what did I just say and what did that mean to me? And so that was, you can almost, with the reflection, you can almost see Austin's like brain working, hey, well, what does that look like for me? What did I just say? What is important? And what are my values? And being able to verbalize that and kind of take himself a step back with that pause so he can go forward.
And here's Todd's theory on that. Thoughts in our head are just rattling around, and that's what they are. They're just thoughts. We say them, they become a little more real. We hear them reflected back, and now they got a lot more substance to them. It magnifies the meaning of the thoughts.
Autism. All right. Perfect. You guys did a great job. Thank you for sharing your thoughts on it and insights on it. So like they said, we will have you doing it yourself and practicing a little bit and getting to jump in on Thursday, but don't lose sleep over that. We're going to walk you through it. We're going to hold your hand. We're not going to set you up to fail anything. We're always going to be here to help you and guide you through it. So this just gives you the opportunity to try it on, see how it feels to reflect, how to kind of talk to somebody in a different way than we're used to. So think of it as something just exciting and new that you get to try out. Okay, so with that, Charlie is going to go over a few things that are going to supplement your learning in this course.
All right, so everybody should have got a link to their email literally just now. And then we will be using our learning management system to help supplement the learning. So check your junk mail, check your other, all those types of things, but you should have it in there from the Wellness Effect. When you log in, this is exactly what the course should look like. I'm in here as a learner. Let me go home so you can actually see it. It'll say, well, actually, I won't say that. This has the other coaching course that I have, but yours will have Health and Wellness Coaching Course, May course. I have to go over here though, because I have all the courses. So, but that should be on your main page. And then whenever you jump on here, right, you can start course, you can read through it. It'll tell you some of those requirements. But ultimately, when you come down here, the schedule is not right. I need to come in here and update that. But we're going to be working on getting this updated. Now, the key factors in here that you need to really look at is you have the psychology manual. If I were you all, I would be reading along this manual as we go along. This will help you for the exam. If I had to pick one book to focus on, it is this book to help you with that exam. So that's the reason why I say that. Read along as we're going through it. For the most part, as you can kind of see down through here, we've already kind of covered some of these things, coaching relationship, coaching presence. But ultimately, this gives good examples. It goes into it a lot, talks about different ways. You have access to it. It's a free PDF. If you want to go out and purchase it, do what you need to. But you should be able to download it from here. Look at it. You can mark this as complete. But going back to the main thing, we also have these other ones. We have motivational interviewing. There is a new motivational interviewing manual out. I don't think there's much change. If you're pretty well versed in motivational interviewing, don't go by the new one unless you need to, or work will help you. This old one will get you right through it. Coactive coaching, same thing. It's another great book to kind of study, and Changing to Thrive. But again, if I were you and you had minimal time to focus on studying, I would study this one. And I would read along as we're going through it. Now for this coming up week, we have mindful awareness, stages of change videos. So you'll kind of have these in here. We'll update these slides as well. You can kind of see they're darked out right now, but eventually you'll have full access. We'll have the slides for the next presentation coming up, and they'll be in here very similar to this right here, right? So this was today's slides. We'll update it with the slides that will be coming up next week, or on Thursday. And you'll have access to be able to come back and forth. So if you really wanted to jump ahead, we'll have different articles that you can read. We got videos on Illicit Provide Illicit. That is not us, so you'll be able to kind of learn as we go. Ultimately, these are due by that Thursday. However, I will tell you, your grade, don't stress out about it. Your grade has absolutely nothing to do with this. We want to make y'all exceptional coaches. We don't care about whether y'all can follow along in a learning management system. But what we do care about is making sure that y'all kind of watch some of these videos ahead of time, get familiar with the slides, kind of come in, because there is a lot of material. We have demos in here. So coming into next week, we will definitely make sure you have access to all of these videos here. I don't know why it's being weird, but we have another video in here that you can watch.
It didn't record. There it goes.
Dr. Graham doing stage 1. So you'll have 2 options of it. So anyway, you'll be able to come in here and play around with this. Have any questions that you might have ready for next week, or, on Thursday, I mean, and then we'll be able to answer any questions you might have. But again, by Thursday, probably the biggest picture would be to get logged on. And then that way maybe watch that stage 1 video. We'll also send that in an email just in case y'all have trouble logging on, because we don't want y'all to, miss out on that. I think we We should have it on our YouTube channel, but if not, we'll get it on YouTube and get it out to you. Let's see, any questions about this process right here? Okay, so now I'll close that out and I'll talk a little bit about the agenda and schedule. So pretty much we meet every Thursday. I will say the next 4 Thursdays would be the times not to miss. If you had to miss any other class, miss those. But the next 4, and I say that because you all will be learning coaching. Literally, we dive right into it in this course. We'll teach you a little bit of coaching skills. We'll teach you stage 1, and then we're going to break y'all out into dyads and triads, and y'all are going to practice right there. We'll have a mentor, hopefully, that will be in the room with you, and they'll provide you feedback. But ultimately, that's what we're going to do, and we're going to do that in 4 stages. So we're going to have stage 1, you know, just like that whole diagram that Haley showed you that showed stage 1. We're going to do that next Thursday. The next Thursday after that will be stage 2, then 3, and then stage 4. And that's literally the run of the show for the next 4 weeks. If you do have to miss, it's not that big a deal, but please, if you could, just because another thing is if you start stage 1 and Austin and Kirby are partners and they're coaching each other, and then Kirby doesn't show up to stage 3, then it kind of messes the stuff up. So, and I'm not saying Kirby that you'd be the one missing. I was just really calling out.
No, that sounds about right. That could happen.
That's accurate.
I'm kidding.
No, you're good. So anyway, I think that's, you know, again, we'll work around it, but if you could, I think that'll also help your learning experience. And then after that, what we do is we then break y'all up into dyads that are completely different people, maybe potentially depending on how it works. And then y'all will record your sessions, and then you will send it to Todd, a mentor, myself, Haley, Brian, Steven, whoever it is. And then they will critique your video or watch it. I shouldn't say critique, but y'all might critique it together. But y'all will come together as a mentor and then go over your video and really hopefully move towards proficiency. So that's a little bit of outside of work stuff that I just talked about, our outside of class stuff. The sessions, like let's just say, for instance, Mark and Austin are partners. Y'all would set up that time outside of class on your own, whatever works around y'all schedules, record it through Zoom, Teams, something or another, and then send it to your mentor. And we'll have all that stuff spelled out for you by the time it's over. Maybe not when you meet, but that'll be kind of on you all. And then you'll work with your mentors on scheduling that time. Coaching sessions are only 20 minutes. I don't know if we really emphasize that enough, right? You're only doing this for 20 minutes at a time. If it's less than that, like Todd did, that's okay. As long as you feel like you hit everything, don't feel like you got to drag it out to that 20 minutes just to be dragging it out. You know, if it ends naturally, let it end naturally, because that's what you would do in real life, right? You wouldn't try to just bring something up to bring something up. You would just go ahead and end that session. But anyway, any questions about any of that process? And to graduate this cohort, I know we ain't talked about that either. For the most part, nobody ever fails, right? So don't worry about that. This is not a pass fail. This is, we're going to work with you until you are a health coach, or you give up. I think we're going to work with you as long as you're trying to get you through all these credentials. But ultimately, the big picture is we have what's called a practical skills assessment, and us as mentors will watch you do your coaching session, and we grade you on that. And what we grade you on is what Haley showed you right before Todd did the coaching session. Those coaching characteristics, we literally grade you on that. We know that if you don't use them, you know, we ding you on that. We give you a written feedback that says, hey, this is what you kind of were missing. But we also give you real life feedback in those coaching sets, or in next week whenever we get together too. So you'll get the feedback that you need to grow. So don't worry about the pass fail part of this. Let's see, any questions about any of that?
Do you guys do, is there any like practice exams for the exam that we can take?
So I didn't show that part, but you're going to be taking quizzes throughout this entire phase. It'll be just 10 questions, just something that y'all can kind of get familiar with, start looking at how they're asking the questions. And then at the end of it, we basically compile all the same questions into a practice exam type thing. So you'll have access to that. We also will give you a cheat sheet. I will say a cheat sheet meaning that kind of goes over all the biometric data, like what your blood pressure should be. So y'all can kind of study that stuff. I will say the people who fail the test the most are clinical people because they base some of those metrics off of different things. We will only use this exam will only use CDC and the WHO, the World Health Organization. There's a few other ones. I think it's like Lifestyle Medicine. They do use that website, but ultimately the metrics will only come from the CDC websites if it's like blood pressure and things like that. So a lot of healthcare providers, the American Heart Association or something might be just a little bit different, and then they go into the exam, and that's what they fail. So what we give you will be what will be on the exam. So learn those metrics. But again, we'll focus on that a little bit more. But that's a good question. We'll help you prepare for the exam. I'll say the national board, and I have not heard any results of their practice exam. They just came out with the practice exam maybe 6 months ago, maybe a little bit longer than that now. But they just came out with one at $65. I haven't heard if it's great. I haven't heard any results of it. I know nothing about it. But we actually talk about some exam prep later on, and we go over some resources and other tests, places where you can purchase tests and things like that if you want. I'll say you don't really necessarily have to. I think if you purchase probably that national board exam one, that's $65, and then go on some of the Facebook websites that are out there that put questions out like once a week and things like that, you could probably get pretty good with the test that way. And if you have not taken a standardized test, that's the biggest thing I would ever say is get used to how they ask questions in a standardized exam.
Don't get overwhelmed. It is day one.
Yeah, that's right. Don't worry about the exam.
All of this will come. Don't worry about it today.
That's right. But Austin's a researcher, right? So.
Right.
Enough said.
Enough said.
All right. Well, let's see. Questions. Any questions? Any other ones? That was a good one. I will say these books, don't go around telling people they're PDFs that we have probably stolen from somewhere. So don't go around. We most certainly have some anonymity and with all of that. We don't want to go around telling people we're just giving out PDFs. But it's a learning environment. How I feel like I'm justifying it in my head. It's a learning environment, and the PDFs are out there somewhere. So
I have this on recording for the court system, so it's fine.
That's my justification, court system. Ignorance of the law, I don't know if that's
is no excuse.
Oh, that's the saying. My bad. All right. Well, if y'all have no other questions, we can end for today. We were going to talk a little about reimbursement models, but I feel like just know right now there's Medicare that is a reimbursement model. There you can take health savings accounts. We're going to go over this as well later on and really talk a little bit more about the business aspect of this. But there's also the model that people say come to us for 6 health coaching sessions and you get 10% off each one of those if you pay up front or something, or that type of model. But ultimately, I also feel like one thing that I talk about a little bit later is the best way, in my opinion, to get a contract is to start specializing in something. In the last cohort, there was somebody who wanted to specialize in postpartum depression. And, if you start working with the OGBYN clinic for that example, and then you're working with them and you're taking their clients same day access, right? Almost 24 hours, you're contacting them, right? And you're getting them in. And then all of a sudden you can now go back to that healthcare provider and say, I want to continue doing this, but I can't do this if I don't have a contract set up with you that you're going to fill or pay for at least 10 slots a week in my week, right? So then that's another way to generate revenue is to have that partnership, and then they're paying you to fill seats, I guess you can say. And then they're always going to be filling those seats, right? So you have that contract, then you have, get credentialed through Medicare, then start getting Medicare patients, and then taking health savings account clients, right? So then you have 3 streams of revenue. I always kind of harp on 3 streams of revenue whenever you do that. So then that way you can kind of manage the ebbs and flows of private practice and all that type of stuff. But anyway, we get into all that stuff later on. Maybe not too in depth, but we'll have an opportunity to ask questions, talk about those models, talk about barriers and challenges to it too. So. All right. Well, if there's nothing else, we'll see y'all another day. See y'all on Thursday.
See you another day.
Okay.
Thanks, guys.
All right. See y'all. Thanks for being here.
Bye, y'all.
Bye.
Bye.
Bye.